Okay, I would like to welcome everyone to another episode of Time to Large and Talk. And today I have a very, very special girl guest, a very pretty, beautiful lady, and she's a doctor. And today she's going to be talking to us about women's mental health, what mental health is all about. We're just going to jump on the on our topic for today. And before we get on the topic for today, I'm gonna just tell you a little bit of bio, just for you to just know who she is and everything. And also when I'm done, because it will not sound right if you don't hear it from her about what she does and who she is and everything like that. So let me first read your bio. And first of all, I want to say thank you so much for honoring this invitation to come on this show. I really,
Thank you,
really
Bukky.
appreciate you so much.
Thank you.
Okay. All right. So let me read your bio just for our viewers to just get to know who you are. I have with me here Dr. Neha Sharma. She is a neonatal consultant and in London and global ambassador for Aesthetic International Council of Progressive Women. She is a global ambassador for All Women Rock in US, ambassador for London International Human Rights, and also ambassador. Let me see, where is it again? Sorry, and
It's
also
a,
ambassador overseas doctors, and also NRI representative for India safeguarding, child safeguarding team. So you know what? I just read your bio, and it doesn't really sound right, but it's always good to hear it from the horse's mouth. So, Dr. Neha, who are you? What do you do? Tell us a little bit about you. Okay.
Thank you, Vicky. Thank you so much, Vicky, for the kind introduction about me. My name, as you rightly said, I am Dr. Neha Sharma, one of the neonatal consultant, a very proud medic, a very proud frontline worker, currently working in London. And I'm very, very proud about my background, being trained from India, and thereafter, after finishing off my fellowship in intensive care unit and my post-graduation in India, I came to UK in 2016. And since then, I'm serving NHS. And it's absolutely my pleasure that today I'm here with Bukky, with very beautiful Bukky, to speak about something like a topic which is very, very close to my heart. Because there's one mission which I'm working on, that is on mental health. And the name of my mission is Healing by Healer, or Healing the Healer. And it's all about, when I go for any conferences, any medical conferences, I always speak to the junior doctors or my colleagues or my seniors. And I always discuss about mental health issues, because this is something, okay, I have seen it's just not local people who are actually suffering with mental health issues. Even many of the doctors or the medics, they are suffering from mental health issues. And it's very, very obvious, because this profession itself is a big responsibility, because obviously every eye is focused on you, and you can completely understand it's not about just dealing with some gadget, and if something happens wrong, that's fine, we can fix it. It's all about that you're dealing with a human life.
Yes.
You have to be very careful, you have to be up to date with your knowledge, your skills, you have to be compassionate, you have to be empathetic, you have to be because when I work in the hospital, it's not about me just treating a sick newborn baby. It's me even healing the traumatized family who is going through a tough time, when they are just being, for the first time, they are being mom or the parent, or maybe they are just, they have previous children, and then this is their newborn. And because of some reason, if this newborn is separated, obviously it imparts a massive extent of anxiety to the family. And obviously, if this keeps on going on, it affects their mental health, it affects their milk output, it affects their caring, and a lot of things happens. So that's why my mission in life is to deal and to discuss as much as possible about mental health. So here I am today. And as Bukky gave a long list of my background, I just want to say I'm a very simple human being. I'm blessed that so many organizations, they felt that probably I can be their ambassador and I can serve the community with the best of my potentials. I'm very, very kind to them. I'm very humble to them. Thank you, Bukky.
Wow, thank you so much. You do a lot of things. And you know what? One thing about me is whenever I want to have a guest on the show, I always kind of sniff around. I sniff around because the thing is, I want to get to know who they are. You understand? So that I can know what to tell, what to ask, what questions to ask them, and how to relate with them. You understand? And I found out a lot of things about you. I found out that you can dance.
So, Bukky, this is another way of me taking care of my mental well-being. That I have massive passion, I should say, that since my childhood, my father was he was in the music basically. He was a senior police officer.
Yeah.
So it's not about that, that he was like he was bypassing his duties or anything. But at the end of the day, when he used to come back, he was always like, enjoying the music, singing. And this is what I've seen from my entire childhood. And that's why when I feel depressed, when I feel sad, when I feel frustrated, when I feel completely burnt out, when I feel happy, when I want to celebrate, I dance.
Yes.
And this is the way of me actually releasing my like that negativity or that heavy heart or any emotional trauma which I had throughout the day. When I hear Bollywood music, when I hear any Hollywood music with a dancing beat, I can't stop. I just have to dance, and that's the way of me dealing with my mental health.
I think that is really good. You see, I can relate with you on that because the thing is, you see, the topic we're gonna be talking about today about mental health. A
Yeah.
lot of people they think that the people who have mental health and the people who come forward to say, you know what, I have a mental problem, they think they are weak. You understand?
Yes.
But they
Yes.
don't realize what most people don't realize is, you
Yeah.
see, in life, in this world that we have, all of us, no matter who you are going to go through mental challenges. You
Yes.
understand?
Absolutely.
And it's how you control yourself. You understand?
Yes.
When you go through that mental challenges, that is what really matters. You understand?
Yes,
Like you said,
absolutely.
yeah,
No,
yeah,
and there is a well said saying as well, Bukky, that you don't have to be positive all the time. It's
yes,
okay to feel sad. It's okay to
exactly,
feel angry. It's okay to feel frustrated at times. It
exactly,
doesn't mean that having these feelings make you more negative person. It makes you more human. And
exactly.
that's why it's important. Like, you have to understand, being human, there are limitations because you're emotional. You are being made genetically in
Yeah,
a way that you'll have your own sensitivity to the different things which is happening around you. So
yeah,
it's okay to have these kind of feelings, but the most important thing is how you actually deal with those feelings, whether you let it impact yourself, your inner self, your inner soul with that feeling to that extent where you literally you don't find any solution and you take a very wrong step in your life,
yeah,
or you deal and face the music in a very strong way and you come up with that. So I feel there's a lot of people, they say that I appeared in this exam, I was going through this thing, I applied for this job interview, I couldn't get shortlisted. And obviously this has happened with me as well, that I was trying for something different. Like I wanted to be a dermatologist as my first choice.
yeah.
And then obviously like that was one of my choice, but second choice was pediatrics. But in India we have a different like entrance exam. It's not like in UK where you appear for the interviews. In
Oh,
India you have to appear for all India level examination and then you got your seat. And the competition is so stiff and so cutthroat competition is there, Vicky, that a lot of people, they do have mental health issues just because they're not getting selected and this thing has. So I'm not saying that I was ever being not impacted by these feelings. I have my own dark days, and I myself has got like some of the light days as well. But the most important thing is, you have to think that these failures, I feel like these failures are not failures actually in reality.
yes.
There's no word called failure. Either it gives you experience or it makes you more wise,
Mm,
because if the similar thing happens next time in your life,
yeah,
you're already being exposed to that situation. So
yeah,
you are much better in a much better position where you can deal with the similar situation in a very different way. Your
yes.
perspective will be different. You'll be more comfortable with it. And just because this is already being happened with you.
Yeah.
So I think, it's all about that. So people shouldn't be getting upset because of those things. They should take it on board as a challenge, and they have to, every day, they have to refine. Wherever they feel they're lacking, they have to keep on refining themselves. And this is how the life goes on, and this is how we should be looking forward to our life.
Exactly, exactly. You know
Yeah,
what? I feel like because the thing is, before I invite people on
yeah,
the show,
yeah.
like I said, I study people online. When I get on Facebook, I just don't know. I just don't look at I don't look at their pictures. You understand? I try in a way. I try to see who they are. You
Yeah,
understand? And what they do in the society. And you
yeah.
know what? I have watched a lot of your videos. You understand? And
Okay,
I'm like,
okay.
wow, this lady here, apart from the brain that you have, apart from the beauty, you still have what you speak out, the video that you make, they just touch me. You understand? You know what? And I feel like you are just the right person, and I'm just so glad that I reach out to you. And when I
Because
when
the
I
beauty lies in the eyes of the beholder, and I'm very, very thankful because you're kind. That's why you see everybody kind. And I think I have done a good homework that I'm posting a lot of things on social media. So I'm very, very impressed that actually I'm getting more opportunities just because people are following my profile. So thank you so much, Bukky. But it's all because of you. You're a very kind person.
You are very welcome. You're very welcome. So, you know what? Even what you just said right now is like we basically touched all the topic, all the questions that I wanted to ask you, everything. But you know what? We're not gonna stop at that because the thing is, like I said, I study people. I try to go on Facebook, Instagram, and all these social media platforms,
Yeah.
and I study people. And I've heard things that comes out of your mouth. You understand? And I am just so impressed, and I'm so glad that
Yeah.
I
Thank
chose
you.
you and you are
Thank you.
here, and you are here today. And and when I bring people, apart from their profession, apart from educational background, you understand?
Yeah.
They just don't talk about what they read. You understand? They talk about their life experiences. You understand? And because
Yes.
people don't want to know about what you read, you understand? But they
Exactly.
want to know, do you have empathy? Do you feel what I'm feeling? Are we on the same page? You understand? So
Yes.
with what you just said right now in regards to mental health, I feel like apart from the educational background that you have, you also have experience what mental health challenges is all about. And
To
you
be
also
honest, Vicky, there's no single day where I'm not being affected. And obviously, my profession brings these situations very often in my life where I've been involved with, newborns who need emergency resuscitation at the time of birth, and having gone through a lot of things right from the very delicate age. But nobody in like the human life doesn't deserve these things. But when these things happen, this is something like very unexpected and unfortunate situation which we all as a healthcare professional deal in our common day-to-day life. And that's why it's very important to have a very loving relationship, personal relationship. I'm very blessed that my better half is there with me all the time, and at the moment he's watching me as well. So I'm very, very fortunate. I'm not just saying that it's just because he's here, but I'm just saying that it's not possible unless until I've been thoroughly supported by my family, because obviously whenever I get back from work, it's a very heavy heart with which I come back. We
mm,
have connection, like there are psychologists, there are psychotherapists on board, in a lot of units where they are constantly there for the families as well as for the doctors, because it's not just the family who is going through the tough time. Being a
yes.
female, it's a very challenging situation for me as well, because for me I haven't seen any like normal newborn baby except in my family, who are like, I always come across sick newborns. So I'm a specialist of dealing, like managing just the intensive care unit where there are only sick born unit babies, or maybe the babies who are getting prematurely born.
Mm,
So for me, there's nothing like a normal newborn baby. So for me, being a female, it's a very heavy message to take on board, that there are normal newborns as well who are getting delivered and they're going home directly without coming in contact to me.
yeah.
So it's like too many things happens, but at the end of the day, you have to understand that this is something like, you have to understand that you have to embrace your life. And this is what I say when I meet any of the family. Every day I have to counsel the parents for all the newborn babies who are being there. And
Mm,
the first thing I always say that I'm more a spiritual person. A lot of people have given you a very theoretical background about your newborn baby, that this has happened to this baby and your baby, and this is what we are doing, this is the plan, this is the condition, probably the prognosis is not that great. But I never say that. I
wow.
always say that I'm a very spiritual person, and I know that parents' positivity and support play a vital role in recovery of the baby. If
Exactly.
you are optimistic, if you are positive, this is the same vibe you're going to give the healthcare professionals or the nurses or the doctors who are actually handling or dealing with your newborn baby. And at the same time, this is the vibes which you will be giving to your newborn baby as well when you are sitting at the bedside. So it's very, very important for you to not to lose the hope, because I never want the parents to lose the hope. But obviously, when the circumstances are all together in a different direction, I have no choice except to being a batch holder of breaking the bad news. And I feel that is very challenging for me when I have to tell that I'm very sorry, your baby will not be able to make it. It's one of the hardest time or hardest thing I have to do in my profession, which I don't want to be a part of that. But unfortunately, I can't avoid those situations.
Yeah.
Only thing I can say to them that God has got his bigger plan. And this is what I believe. He has got his bigger plan. Everything which happens in your life is because of some reason.
Yeah.
You will not understand that reason at this point of time, but down the line, in 5 years' time, 6 years' time, you will feel that was the best thing which happened to me. And
Wow.
probably if I would have stick to the same thing which I was thinking that, well, this should be the only thing or the best thing which should happen to me at that point of time. Probably that was not the right thing for you, and that's why that didn't happen to you. So everything has got a reason, everything has got genuine reason, and God has got a bigger plan. But if you believe in that, then only you'll be able to navigate in all the life challenges in a better way. Otherwise, there's no way you can save yourself.
Wow, wow, wow.
Yeah.
And so, because I heard you referring to God right now, and you know the way the whole world is. Some people are skeptical, they are doubters, they don't believe in God. So how do you, when maybe something happened during this time, maybe a mother is giving birth and something happened, you understand? How do you now tell them, you know, that, you know what, this happened, and I want you to know, I mean, the people that who are skeptics, who are doubters, who don't believe in God, how do you now tell them that, you know what, God has a plan for you or something like that? Because I know they were like, wait a minute, don't tell me about God here because I don't
Yeah.
believe in
Yeah.
God. But so how do you now tell people like that about
Bukky,
that situation?
that specific moment is very, very emotionally traumatizing to the parents
Exactly.
or to their families. And in no way they are in a position even to say that I don't believe in God and I don't accept what you are telling to me,
Mm,
because they are so emotionally traumatized at that point of time that they accept whatever is coming through them. And somewhere, like, because a lot of time what happened, we have fetal medicine unit as well, like there's another department with which we closely work with. So one is called obstetric team, which deals with the mothers. There's
okay.
another fetal medicine team, is a specialized team which basically do all the scans and everything. And if they have any doubt, they start doing priming of those moms from the very early days. For
Okay.
instance, if this baby has got a problem, this priming is already being started when she's pregnant. She is knowing that my baby will be born with that thing. So
Mm,
somewhere they are being prepared. But sometimes some news are unexpected, like something happened, like something. Sometimes the things are not under our control, and even like normal pregnancy, 9 months, no problem, and eventually the baby was born, and then he required all sort of support, and there was a very poor adaptation after birth. So
mm,
these things are unexpected, but that moment is so sensitive, that moment is so emotional, that moment is so traumatizing that I have never came across any parent saying that we don't believe in that. They are in a more receptive phase. It's just a matter of being in that situation where they can trust you what you are saying.
mm,
And when this situation is there in front of me, no matter whether I had my meal, no matter whether I have eaten anything since morning, I just sit with them unless until to the extent where I can give them little bit. I know that there's nothing in my hand now. I can't do anything more than that. The
yeah.
only thing I can do as a human being, by being with them, just telling that what you are feeling is right. Anybody at your position would feel exactly the same the way you are feeling.
Mm,
I'm very sorry, but trust me, he has got his plan. And
wow.
this is, and if I feel like Bukky, a lot of time, like a lot of babies, they already have their diagnosis that they will be born with this condition, that condition. And it's very difficult. It's very difficult for your newborn, like a newborn baby to see going through all these things. But I sometimes feel if something happens, like I don't want to be brutal, but I'm really I wanted to be very realistic about the situation. I feel it's just not about taking a live newborn at home who is being born with so many complex issues where the baby himself is going to suffer and the entire family is simultaneously going to suffer for the rest of their lives.
Yes.
So it's just not about taking the baby home. Like there are a lot of babies with cerebral palsy, like they're being born, there's some sort of hypoxic injury happen at the time of birth. They had also like seizures in the early few hours, like which is called as epilepsy or these kind of seizures, abnormal movements.
Mm,
So these things are completely uncontrolled, and this is something which is very unexpected. But
yeah.
I find sometimes that it's very difficult for these parents to go through that lifelong suffering, you know. So it's really very important to give them a sense of reassurance, to be next to them, and
Mm,
to make them understand everything happens for a reason.
wow.
Everything happens for a reason, and this time will pass on. And remember, there's always a sunshine at the end of rain, and things get better soon with time. So this is what I believe, and I think this is the way to look forward to the life.
Wow, I really like that, and I love your belief because the thing is, we can go through life without believing in God. You
Exactly.
understand, or being spiritual because the life is tough. You
Yes,
understand, life is just
absolutely.
so tough. You understand, so
Absolutely,
yeah, so
absolutely. And Bukky, like a lot of time, we see that, we feel sometimes we feel that, okay, this individual is in front of us. She's very smiley, he's very smiley, or probably there's nothing. He's very rich, he has got this, and look at the car he has got, look at the wealth he has made, look at his educational back. But no, everybody has got something or the other thing in their plate to deal with. If it
Exactly.
is not mental health, it's a physical health. If it's not
Exactly.
physical health, it is some sort of financial problems. It's some sort of, or even like if everything is going very well, they have problem in their personal life. Their personal relationship is not working. So
Exactly.
everyone has got something or the other thing. But it's all about embracing the life, living in the moment, and not to mourn about the past, not thinking too much about the future, just making most of the present moment in which you are living. And this is how I see the life.
Wow, wow. I like your view about life. That is just it's just a very nice view. You understand? It's a nice view. So thank you so much for that.
Thank
Okay,
you.
well let's get I know like I said you touched a little bit about on the topic that we're gonna be talking about today,
Sure.
but we still need to go into the question and
Yeah.
ask you the question that I'm supposed to ask you anyway. So
Yeah.
let's start on mental health
Mhm.
challenges and I'm gonna be asking you what mental health is all about,
Mhm.
the symptoms, what we need to look out for and stuff like that. So let me start on today's section. You see, mental health challenges are sometimes invisible, you understand? And no matter how confident someone might appear, or no matter how happy someone might seem, they often hide whatever it is that they're going through. You see, and because we always hide it, people cannot even tell that. That's why it's invisible. You understand? And also one thing that I find out is growing up in Africa, you see, if we find out that someone has a mental problem, you understand, the first thing that comes to our mind is we get the picture of this what is it called, a tattered looking, unkept looking person, you understand, we are, and the thing is when we are on the street maybe playing or something like that, and maybe we see a crazy someone who looks so unkept and everything like that, and maybe we point the direction of the person to our parent, the first thing they usually say is, don't go near that person. If you go near that person, you're gonna turn into a mad person as well. You understand? So we all have in Africa, we have this belief that anyone that goes through mental problem, is like contagious. It's like it's
Yes. Yes.
contagious
Yeah.
this, you understand? So we try to get away from people like that or something like that. And also for hers, whenever we're going through anxiety or depression, for us to tell other people it's a problem, because in Africa, if you tell someone that, I'm having this anxiety problem, I'm having these kind of health challenges or something like that, they look at you and be like, aren't you African? African people are supposed to be strong. You understand? We have that strong whatever. You understand? So you are not supposed to be saying that. And if you say it to people, they will consider you as a very weak person. You
Yeah.
understand? But they don't know that one thing that I notice about life is no matter who you are, like you've been saying right now, no matter who you are, we are all going to go through mental challenges in life. You understand?
Yeah.
No matter how perfect you think your life is, no, so we're all going to go through mental challenges. And what I find out, this is my own story, you understand? So
Yeah.
it's gonna be off the record. What
Yeah.
I found out about life is when you put five people together, there's a probability that one of those five people, they're going to go through mental health challenges. That is my own story. You
Yeah.
understand?
Yeah.
So I don't know how accurate I am
Yeah.
in regards to that, because mental challenges is not just about someone looking unkept. Even someone might even look, like you said earlier, they might look like everything is going well for them. They might look so pretty. Their clothes might be like glittering, or they might put on all this bling bling stuff, but still there's something in their mind that they cannot let people know that this is what I'm going through, because of the stigma, the way people will classify them. They'll be like, oh, you're a weak person, or this and that. And one thing that I also find out is African people, we don't like to go for a check, or maybe like to go and see a therapist in regards to whatever it is that we're going through. In the sense that when you tell people, or when you go to a therapist, people who knows you that maybe you're going to a therapy, they're gonna consider you as a very weak person. You
Mm.
understand?
Mm.
So my question to you today is, Dr. Neha Sharma, what is mental health?
I I I think I can connect with you, Bukky, what you said, and I can completely. It's unfortunate, like that there's so much of social taboo associated when we say that some person is having mental health issues and is needing help from the specialist.
Yeah.
But I feel that's the most courageous thing which you can ever do in your life. because it's not about like the how what people think about you. It's
Yeah.
all about how you're feeling at that point of time about yourself. And
Yes.
the first thing is, like, I have seen, if you have a very supportive network or a very loving relationship within the family and friends, even though if these things persist, there is an easy way of let go because you have people around you. Sometimes what you need is somebody just to say things will be okay. Don't worry, I'm there with you. Even though they can't do anything for you, but if somebody just say that I am there with you, please don't worry, things will be okay. It's okay to feel like that. And these kind of reassurance and loving words are the most important and desired word which is needed at that point of time. So I completely understand that this is what is like a lot of people they come up with. It's just not the condition in Africa, even like back in my home country in India. These are the similar things where people are hesitant. They are hesitant to go and take their help. And which I have seen that in UK, people are quite outspoken about these things. That I have a mental health issues, I need specialists. And like even when I go for my work here, when I'm working like since last 4 years, I'm working for NHS. I've seen people are very, very outspoken and extrovert about getting us help from the specialist because obviously they know that this is something which is there for them. It's something which is easily accessible to them. It's all about expressing to your specialist that I need help. Yeah. But that's completely opposite in our country. And I completely understand that this is the same in India. But the most important thing to understand is, Bukky, that it's you who is suffering from within. It's you and your inner soul which is suffering. And when you just allow these negativity or negative feelings to pile within yourself, at some point definitely it's going to explode. In which way it will explode, you have no control. Sometimes people do take some extreme steps where they commit suicide and those things, and that is very, very unfortunate. And these are those individuals who many times gave subtle hint to the people around, to the family around, to the friend around, that something is not right with me. I'm feeling stressed out, I need more support, I want somebody to just listen to me. Sometimes you just need somebody just to listen to you, irrespective of whether you're right or wrong, because you're not in a position even to decide whether you're wrong at that point or you're right at that point. Because your receptivity at that point is not to the extent where somebody's trying to make you, oh no, Neha, you're wrong here. No, I'm not in that position at that point of time to understand what you're telling to me. I just want somebody to listen to me at that point. And I feel that if somebody is there just to listen to you, this is what exactly the psychotherapist or the psychologist they do at that point of they just listen to the patient.
Exactly.
And unfortunately, when this thing never happens, like obviously in UK it is quite accessible, but when these things never happen within the family, within the friends, you have to escalate. You have to escalate, and it's not you're escalating just because you are afraid and what people will think about myself. It's you are escalating just because you need help at that point. You need a friend at that point of time who can just listen to you. Because even like Vicky, I'm not ashamed in saying that. Like at one point of my career, like when I was here, there were a few of the newborn babies who were like very sick. They were there in the unit like for 3 4 months, and then they died because of something or other. It actually impacted me just because I was very closely emotionally attached with their family. I found it very difficult to let go. And I was like literally, and I was one by one, we were receiving other newborn admissions, but I was stuck. I was stuck with my previous thought because I was just thinking whether I could have done something differently, whether how could I have made difference, I could have saved this life. And but unfortunately, this baby had a lot of genetic problems and complex issue, and in no way we could have done anything differently. But as a healthcare provider, I felt very helpless at that point of time,
Yeah.
and it impacted me as well. And obviously I came to London at that point and I was new here as well. There's a lot of things, there was not much emotional support as well. There's a lot of things. And then at that point of time I decided to speak to the psychologist. And I actually, and there was no, like, I felt there's no shame because I'm struggling, I'm alone at the moment. I am not getting any relevant support where anybody can hear me or listen to me what I am feeling this point of time. It is impacting me. Why not? And that person did nothing except to hear me, like to listen to me just for 1 hour. I
Yeah.
was the only person who was speaking, and she was like completely quiet. She was not even telling anything. And at the end, she asked me, Neha, what do you think? Like, what are the things which you can do in order to, to feel better? And I myself say that probably I'll do more meditation, I'll do involve more, like I anyway do exercises in between, although sometimes it is not possible because of my shifts. But I said, okay, I'll do it regularly. I'll be meditating when I'm traveling in the tube, when I have got 1 hour when I'm going back and forth. Maybe I'll utilize that time to do meditation. And I'll try to be as optimistic. So I was the one who was coming up with the problems. I was the one who was giving the solution. But
Exactly.
the only thing which was actually
Exactly.
making my inner self more comfortable, that
Yes.
somebody was there just to listen to me, to
Exactly.
understand me what I'm going through. And I
Exactly.
think, Vicky, it's all about who you have in your life.
Mm.
It could be your friend, it could be your mother, it could be your father, it could be your better half, it could be your brother. Anyone with whom you feel, who understand you, where you don't have to put too much of effort to make that person to understand, that you're right or you're wrong. You don't want those, like, judgmental attitude of the people where they're analyzing that, Neha, you have done this thing wrong, you should have done. I don't want that at that point of time. I want somebody just to say, everything will be okay, Neha. We are
Yes.
there with you. And
Exactly.
that's it. I don't need anything more. I just need a soft, kind word and a
Yeah.
reassurance at that point of time to
Mm.
give me the relief that
Yeah.
fine,
Yeah.
even this thing happened, it will go.
Exactly, exactly. I'm just smiling and I'm so happy because the thing is, when you tell people, especially people who come from Africa, you tell them about going to see a counselor or therapist. They
Yeah,
look at you like those people are gimmicks. You understand? They
yeah,
you're going to a stranger to tell them your personal life history. But I'm
mm,
so glad because I'm a counselor as well, but I'm still in training. You understand?
okay,
And these are the things, all the things that you just said. These are the things that we do in training. You
yeah,
understand?
yeah,
Because the thing is, when you go to a counselor, you understand, they're not there to tell you that, you know what, this is what you should do.
yes,
They're not there to provide advice, but
yes,
they're there to listen to you. You understand?
exactly,
To
yeah,
make the high connection. You understand?
yes, yes,
And
absolutely,
and as they're listening to you, you understand, they will start paraphrasing and start summarizing everything that you told them. You understand?
mm,
And
mm,
during the conversation, during them, you telling them everything, they'll be like, okay, at the end of the day, you will be the one who will heal yourself. You're going to be the
absolutely.
healer of your
Absolutely.
life. You understand?
Healing always start from within, Bukky. Healing
Yes,
always start from within. Sometimes it takes time. It's not something like an instantaneous thing that you thought that I have to get healed. No, it's a matter of over a time you will be healed.
yes,
But it always starts from within, and you're
yes,
absolutely right in saying that.
exactly,
Yes.
exactly, exactly. So
Yeah.
what we need in life is just someone to just be there and
Yeah.
sit down and listen to us without
Yeah.
judging us, without saying that, oh, you shouldn't have done that. Oh, you did it, you did that. No, we don't, no one needs that. Like I said,
Yeah.
just be there and
Yeah.
just listen. You understand?
Yeah.
Listen to
Yeah.
everything. Let me pour everything out. And the more that we see that the person is listening to us, the more we want to pour out
Yeah.
everything. You understand? And
Yeah.
talking, when you have so much on your mind and you
Yeah.
start talking about it, it's kind of relieves you. It's like you have this heavy load on your
Yes.
head. You have
Absolutely.
someone to kind of like dump the heavy load on. You understand? That's just the way going to a psychologist or going for therapy. That is just what it's all
Absolutely.
about. You
And
understand?
I think, Vicky, this is also a very key thing for a lot of couple as well, because I think if you wanted to have a loving relationship, you have to be a good listener, and that is very important because all the problems start when both the partners or the couple, like they both are like always speaking, 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 but nobody is ready to listen to each other. That relationship is very vulnerable to the extent where it can break down at some point of time because
Exactly.
it creates a lot of negative vibes around. It creates a lot of negativity within the relationship. And when we say about this domestic abuse as well, or this domestic violence, which was one of the things which you asked me that you wanted me to discuss, this is
Yes.
all because we are not a good listener. And I'm not saying that just even like for me, like I'm working on it. Like obviously when I go to the hospital, it's a different kind of personality I have. But when I'm at home, sometimes I'm also angry because of the workload or whatever is going on. But it's all about being a good listener, and
Exactly.
this never comes in one day. You have to keep on practicing those things, and this requires a lot of skill, like a lot of time, a lot of your energy.
Mm.
But whenever these things happen, you have to sit down and you have to think in which direction you are progressing in your life. Is it what you want? Do you want really to have this kind of soul relationship? Do you want these kind of arguments to be a part of your daily living? Because for everyone, like we want to have when we go to the bed, we have to think how I have made, like what was my day, how was the productivity of my day, what all things I have done in my life. If any point of time you feel like that, the entire day is just gone and stressing about something. There was so much of negativity. You were arguing with the people. You will never have a sound sleep. You'll not never feel like that, that this is something great you have done, because there's no surety of life. There's no surety of life.
Mm.
Today, people are like, even the healthy individual, they're dying because of COVID or because of something which is like road traffic accident. And, and when these people are gone, you feel like, oh my God, you never even got the time to express that how much you love that person. Like you used to love that person and you had a respect for that person.
Yeah.
I said, don't mourn or don't regret later. They're still alive. Everyone is still alive. Express right now. Tell
Mm.
them right now that, your presence value in my life. It's
Yes.
not about me proving myself right,
Yeah.
me proving you as wrong. It's all about I am giving up, I am surrendering because I value this relationship. And
Yes.
I want to tell you that I love you the most, or whatever. Like it could be a brother, it could be sister, it could be your better half, it could be a mother, father. I said, please, why to have these egos? Why to have anger issues? Why to have frustration in life? You have to tell people you don't know like how much time you have got, how
Yes.
much time others have got. And sometimes I think when I look into the life and when I analyze how the things are, I feel we all believe and we have got a sense of belief that probably we are immortal. We are never going to die.
Yeah.
This is not true. We don't know at what point of time, the day like this, because the clock is still kicking. Like, every day the clock is going on. You are actually investing your precious time. Every day is precious to you. So
Yes.
don't mourn, don't keep your egos, angers, insecurities. Make the most of it.
Mm.
Try to bring smile to the other's face. Try to do something very good for others. Try to serve. And like a lot of time, I even like my family asks, why you keep on doing these sessions? What are you doing? Like you are just. I said no. It gives me satisfaction. It gives me something very positive that I'm doing something. Even if one person, if I can make a difference in one person's life, I'll take it as a reward for my entire thing. Like even if I'm saying something for 1 hour, 2 hours, it doesn't matter. But even if it can bring one person change in somebody's life, I'll take it as an honor.
Exactly. Exactly.
So it's all about embracing the life. It's all about embracing the life.
Yeah, yeah, yeah. From what you were saying right now, like I said, I usually go to people's pages on Facebook, and there was one. I think it wasn't your write-up, but I think you got it from somewhere, someone or something like that, and it says that don't give me flowers when
Yes,
I'm gone. You understand?
yes,
You want to give me
absolutely.
flowers, give me flowers right now. And because people are so fond of doing that when people are alive, you understand?
Yes,
They see that
absolutely.
when they see other people pictures on Facebook,
Yes.
they will just ignore it. You understand?
Bookie, with that message, so many people got so uncomfortable. You know, saying
Really?
they were like they immediately. I received lots of texts, lots of messages from so many people on my messenger, and the first thing was, Neha, you're so young. Why are you posting such a gloomy and such a sad message? I said, and
Oh,
I said to them, this is the whole point. If you value me and if you can take a time out to text me this thing,
yeah.
why don't you value me or you appreciate me at this point of time that I'm valuable in your life? So express yourself at this point of life. I was like really glad that I did the right thing actually at that point.
I love it. When I saw it, I was like, this is really good. This is what we need in the world. You understand? Because
Yes,
the thing is, when someone is gone, they don't need
yes,
the flower anymore. The flower is
exactly.
going to be rotten. You understand?
Yeah,
I don't need no gift when I'm gone. I need the
yeah,
gifts right now. I
yeah,
don't need love when I'm gone. I need the
yeah.
love right now. You understand? So
Yeah.
for
And
people,
somebody even replied to me that, that if you get more flowers when you have died, that means you have really done very good in your life. I said, but
no,
I'll not be alive even to witness that. And I don't want that. Like, I don't want flowers later, like more than what I've received in my life. Please give me right now.
exactly, exactly. This is the time. As long as we're still breathing, this is the time that we need the flower. You understand?
Yes,
Let me know how you appreciate me. Let me know if what I'm doing is good. That when I'm
yes,
gone, peacefully, I'll be like, yes, they cherish me when I was alive, or people
yes,
appreciate everything that I was doing when I was alive. But no,
yes.
when I'm gone, I don't know what is going
Who
on.
cares after that? Who cares?
Yeah, so
Unless until I'm a ghost and I'm roaming around in one of the NHS hospital, that's a different story.
so that is it's not important anymore if someone is gone. Whatever appreciation you can show to people, just do it right now. This
Absolutely.
it's not about it's when I see stuff like that, I don't see that person is sad, or so that person is thinking about something,
Yeah,
out of the world or something like that. It's just the person is just passing a message just for you
yeah,
to just appreciate other people while they are
yeah,
still here. You
yeah.
understand?
And people were like, can you please send us your address and phone number? I said, no. You can only send me on WhatsApp or Messenger. Otherwise, my better half will have a problem.
Wow, the way some people just read it. Wow. Well, thank you so much for that information that you just passed on. So
Yeah,
let
my
me go to
pleasure.
my next my next question.
Yeah.
You see, my next question is what sort of condition are classified as mental health?
So, Bukky, there's a wide variety of conditions which are classified in mental health. If we specifically talk about the bookish language, like they have actually classified them into seven. So,
Okay.
first thing is like anxiety, where a person can have like anxiety or phobia. There's some sort of panic disorders, like where if we see a lot of people or if he's traveling somewhere like in a closed space, and it just heightened their anxiety level. And anxiety could be anything, even like you're appearing for your exam, you're going for a job interview, you're just anxious, you're just being anxious at that point of time. So this is one of the category where anxiety is the first thing, where which is very very common, and it could happen to the normal people, it could happen to the people even with the mental health issues.
Yeah.
The second category is about the mood disorders.
Hmm.
So for instance, these are the people with too much of mood swings, and it's a part like every day they have mood swings, and specifically these are the people with like medical terms we call it schizophrenia or bipolar disorders, where they have at one point they're laughing, at the second point they are just crying. So this is like a mood disorder. So
Yes.
this is second category which can be seen. The third category is a psychotic, like where the person is having some psychotic behavior, where he's seeing some colors and he's hearing some voice and something which is like he's having some delusions and those kind of things. So psychotic could be one of the mental health disorder. Then fourth problem is eating disorder, where you can see in extremes, like where one person is like very skinny, is not eating anything, which is called anorexia nervosa. Because of this problem, mental health issues, that person started not eating anything. And you can see that a lot of models I have seen, even like, with this anorexia, where they're just skinny, they just have bone and there's like a bit of skin or flesh you can see on the top, and you feel like what is wrong with that person, and just because of their mental health issues they don't eat, and they feel that probably this is a better self image they can give to the society. But when we see from outside, we feel that this is not which is acceptable, like and other side is bulimia, where the person overeats, and this is something which is very commonly seen. Like a lot of time what happens is like when the people, when they're obese or they are like, their body habit is on the higher side, they have a subconscious habit of eating and munching, and a lot of carbs and a lot of fries and junk foods and those things. So and they put on weight, and just goes on. This is just a vicious circle, because they are knowing from within that probably they are struggling to lose the weight, but at the same time they're eating and eating, because this is just making them more like, probably this is a way of them getting more reassured by eating something.
Hmm.
So this is like a food eating disorder. Then the fifth category is about the impulsive disorder, where there's a sudden impulse, like some individual has a impulse of stealing something, some person has a impulse of firing something, like just putting a fire somewhere. So these are all different kind of personality disorders, which is called as like basically impulse disorders. The sixth category is again the personality disorder. So where you can see that either these individuals are more antisocial, or for instance, even the obsessive compulsive disorder, which you might be knowing that this is some of the disorder where the person has habit of doing something repeatedly, like she or he is washing the hand, again he'll go back, and again he will come back and again wash her hand, again go back, and this just goes on. So this is another type of mental health disorder where there's a personality, like there's some problems with the personality. The last category is post-traumatic stress disorder, which could happen to anyone because of trauma, because of anything which was like accidentally happened to that individual, and then it has given a kind of very heightened anxiety to that individual, that every time that there is a nightmare, he or she is not able to sleep because of constant and recurring thought of that trauma which happened, or because he or she has lost some body part or something happens. So this is called as post-traumatic stress disorder. So widely, if we see, these are seven categories in which this mental health is being divided. Mental health disorders are being divided.
Thank you so much for providing me with that information. And the one
Yeah.
that is it's not weird, but I just find it. I don't know because the when you say that someone will wash their hands, and a few seconds later
Yeah.
they'll go back and wash their hands again. So I'm
I
like,
have like I have a colleague in my medical college when I was doing a graduation, and
wow,
she had this OCD, obsessive compulsive disorder, and it was really heartbreaking to see that because I can see she's just washing the hand, going and taking few steps, coming back, and it was like I was, and my room was unfortunately in front of the toilet, and I can see she's going in, coming out, going in, coming, and she's not even going to her room. She's just coming out of the toilet and again going in and again. And this was just a constant, like to the extent where it started even affecting me, and I have to unfortunately move my room to other side because I can't see these things on a repeated basis.
yeah.
So it's something very like quite often you can come across.
Wow, wow.
Yeah.
So with someone like that, how can you let them know that I mean, or ask them that why are you doing that or something like that? Is that a way that someone can ask them or something like that?
To be honest, like the key, these are the people like who definitely need help in the form of a psychiatric treatment as well as a medical treatment, support group, and a very strong environment where he or she can be supported. And obviously, these are all like a bit of psychotic behaviors as well. So where you need to consider some medications as well, which can help you to get over this thing. But I'm not sure to what extent it can help, to be honest, because I'm not specialist, so I can't say like to what extent it can help. But definitely, these are the proper patients who qualify to get all sort of support, all sort of counselings, all sort of medical management and support group help in order to recover.
Mm, wow.
Yeah.
Okay. Thank you. Thank you so much for that. Let me go to my third question. You see, with this coronavirus and everything like that, because the way I see the coronavirus is like the normal thing that we used to do. You understand? Like a lot of activities, maybe going to the theater and going to the park. You know, we don't get to do that anymore. And even if you have to go to the grocery store, you have to go to the park still, which they are letting us go to the park right now. There's still that thing in us that, you know what, what happened if I come in contact with someone that has it? What happened if I do this and do that? Do you think this coronavirus, do you think it's going to affect us, you know, mentally? Or do you think any one of us, you know, that we're going through this, do you think we can, in later on in life, or maybe before, I don't know, maybe before the end of the year, do you think anyone, I know this is not your profession, but looking at it, looking at the way the world is, do you think it's going to affect us and make us have mental health challenges?
Bukky, there's no single individual currently in any part of the world who's not being mentally affected with this corona.
Wow.
Even we do, whether we accept or we don't accept. Okay. Even for me, being a healthcare professional, when I'm traveling almost like 18 miles on a regular basis to reach my hospital, I'm scared.
Mm,
Even when I'm going inside the hospital, I'm scared.
mm,
Yeah. And it's the same with any other individuals as well. Yeah. Because we are not seeing our normal life. We, even if we like, even the partial lockdown is being released, you're going to the market, you can see, but you're still wearing the people, like everyone having the mask. You feel being uncomfortable. You still feel that, life is, this is not the life is all about. Like, you still feel that something is missing.
mm.
Yeah. And to be honest, it's a very challenging situation with everyone. And like recently, like few days back, I came to know from my previous colleagues, like, one of my colleagues who's working with me in India, who is like completely, absolutely healthy individual with no comorbid condition. He's being admitted in a serious condition at the moment in the hospital because of COVID. And he is just doing like he's just seeing the kids and that's it. Like he's just doing his outpatient clinic and managing intensive care, which is considered as a least affected age group. If we see so far the studies, the newborn babies or the children are the least affected one as compared to any adult one who are being affected because of the COVID. But definitely it has heightened the anxiety. Definitely it has impacted the mental health. And I think even if the vaccine is being introduced, even if it will take a time for us to get normalized to our normal life, which was there before pre-corona, basically. It will take us a time to recover, to heal, because a lot of people, they have lost their loved ones, and it's not easy for them to forget the fact that they lost it just because of this deadly virus.
Mm.
So probably some of us, like we are by the blessing of the God, or we are very fortunate that we didn't have a similar thing in our family. But those who have actually lost their family members, it's very, very hard for them to recover and to heal. and to get over this thing, even when the vaccines are being introduced, even when the things get normalized. So it will take a long time for everyone to get recovered.
Wow, wow, wow.
Yeah.
Well, since you said it's gonna take a long time, I want to find out. I'm gonna put two questions together right
Mhm.
now. With
Mhm.
this coronavirus, and also I also heard that domestic violence, like saying I'm emotionally abusing someone, physically abusing someone, it can make us to have mental challenges, maybe later on in life or something like that. And also it can make us have maybe depression and so much more. And I want to find out if this is true, you understand, and also what sources or what information does one needs to know. And also another thing is, it is so I mean, what it's so challenging, you understand, to say to people that, you know what, I'm going through this, I'm going through that, because a lot of people, they see it, when you tell them what you're going through, they see it as a taboo, like I said earlier, you understand, they feel like you are weak, you understand. So and because people, they consider it as a taboo, you understand, it's so hard for people to voice out about what they're experiencing, because they don't want people to ridicule them and make them feel like they are just talking nonsense, you understand. So I want to find out, what can one do? How can you tell people? How can you help yourself? You know, especially with this coronavirus thing, how can we help ourselves? You understand, for us to not have a mental health challenges later on. You understand, and like you said, people are just like dying nowadays, and it's just so, the rate that people are dying is just so alarming. You understand? You hear about someone going to bed last night, and in the morning I mean, last night when you
Yeah.
saw them, they were like ill and healthy. Nothing happened to them. You understand?
Yeah.
And in the morning, you heard that they're no longer alive. So, and I'm thinking, and in this year, it's been so like the rate has been so alarming. You understand? So, how can one deal with, all these coronavirus situation thing, domestic violence, maybe physical abuse, domestic abuse, in order for you not to, ending up experiencing burnout, or maybe not to have mental health challenges later on.
Sure, sure. Okay. I think let me answer your question one by one. So about the domestic violence, as I said, it's all about your relationship where the people are not ready to listen to each other,
Yes,
and
yes,
that's why this is something which creates problem in a personal relationship. And obviously, because of COVID and because of this lockdown situation, when the couple are more at home, they're spending more time at home, and even the kids are at home, and obviously when the kids are at home, I can see like a lot of people are saying like, both the kids are here, it's like very difficult, they're not going to the schools, it's very difficult, they're shouting, they're fighting, they're
yeah,
not even seeing their friends, so they're all the time at home, they're getting frustrated. So lot of thing is happening at the moment within the four walls basically, and that's why these things are quite dramatically, if we see the domestic violence basically percentage, how much it has raised in UK from 32 or 34%, it has gone to 64%, almost double. And
wow,
this is during the COVID situation. So you can completely understand like the situation at the moment within the four wall is really critical, because there is a perpetrator who's always there, and there are kids as well. There's a other person as well, and this is just going on because one by one you have no way to help yourself. Okay. And that's why the most important thing is you have to understand your own self first. What you want in your life. How can you help yourself? This is very, very important questions, which I think we all should be thinking every day. What I want from my life and what I should be doing. Yeah. Because the first thing is important thing is if you don't understand your own self, you'll be always confused, and even you'll give up even understanding other people. You're not here to judge other people. You're not here to make assessment how the other people are. Every reaction, sometimes the things is like people react and you don't have a control, but most of the time it could be an outcome of your own response to them as well. It's nothing like the clap never happens with one hand, it always happens with two hands. So you have to understand, most of the time there are only few ways by which you can deal with these things. One is analyzing your own self. What I am doing wrong, why this things is happening again and again with me. There's something which I am doing probably, which is actually precipitating these things. Most of the time you'll get the answer if you think on this question first. What I am doing wrong, why the people are against me, why my workplace people are saying this thing, why this is happening. If you think about why about your own self, you definitely, because most of the time The problem lies within yourself, that probably you are not ready to accept the way that things are happening around you, or probably you're struggling to cope up with that. Yeah. Most of the time, it could be either your response. You're not supporting your colleague, and that's why your colleagues are not supporting you. You have to think by way as well. You can't just say that people are wrong. No one is bad. No one is bad. It's all about what you give to the people is the same thing what will be reverted back to you. If you give kindness, if you give love, that will be the same thing which will be reverted back to you. The first thing you have to analyze how and what are you doing in your own life. You have to understand yourself. Because no matter what you do, Bukky, how much energy you spend, you can't change anyone. The only person you can change or control is you, yourself, your reaction, your responses to everything which is happening around you. So first thing is please analyze your own self. And this is what I do as well, because sometimes I'm angry, sometimes I'm frustrated, sometimes this is not right. And then I sit down and think that Neha, this is not right. This is not your real you, which you want in your life. Because if I keep on doing these things, it will keep on precipitating all the negativity around me. It's not going to help me. Yeah. And this is a similar thing which is happening with the domestic violence. Because you're not thinking, you always think your partner is bad or the thing is bad, or sometimes it could be the reason. You are trying, you are very giving. Like, I'm not saying that the other way things is not right. The first thing is analyze yourself. When you're 200% sure that you are 100% giving, you're always kind, you are doing the things very correctly. It's only the person or the people who are around you, probably, which you can't change or something. Then you have to think, how can you address the situation in a different way? Now, one thing is having a very open and transparent and unashamed conversation with that person, because I think this is very important in mental health. Having an unashamed conversation. That means you are exactly revealing what you feel, and you are having a very honest discussion that this is something which is happening. This is what I think could be done. This is something which is unacceptable. What do you think about that situation? Do you have any different way of thinking how we can address and solve this problem? Because this is very important. It's your relationship. If you're too brutal, if you're too harsh, it is going to break down. And you don't want that, because it's just not you. It's a families, two families who are living together. It's not two families basically, but you can understand that it's a couple who are staying together. But apart from that, even both the partners, their families are also bonded with each other. So it's not about just breaking and move on in life, because this is something which is not a sustainable option. Even if you have done the same thing in one relationship, probably in the second relationship you will again struggle. So first thing is you have to understand your own self. You have to think, if you're quite assured nothing is wrong with your attitude, then you have to see what is wrong, what's happening with that person, whether that person needs any support, whether there's anything you can do. Because a lot of time I've seen, like, I don't want to say much about my personal life, but I was in a relationship in my past, and my ex was basically, he was part of a broken relationship, and where he has seen a lot of domestic violence in his house. And that's why when I was there with him, despite trying my best, he never understood what his loving relationship all about, because he has never observed those things between his parents.
Yeah.
So I was like, I was completely understanding these things, that, that I have to support him. But anyway, that's a different story. But I'm just saying that that person, that any behavior or any attitude from that person could be an outcome of a lot of things which has happened with that person. So
Yes.
be compassionate, be kind. Try to think from his shoes as well. What is making him angry? What is making him annoyed? Why he is so, like, all the time being so violent with each other, like with others or with the kids or with whatever? There might be some reason. And if you come across, if you are able to know that root cause, probably you'll be able to very efficiently deal with that root cause, and you can have a discussion. And then, based on what you think is the right thing with him, you can decide further support or things he wants, in order to recover from that. So that is first thing. As far as COVID situation is concerned, obviously it's something which is completely unexpected, Bukky, and for everyone it's hard. It's very hard thing, even to give any sort of word of wisdom to anyone that how should they coping with it. It's a very difficult question, but at the same time I think it's all individual perspective. It's all about how you see your life, because the moment you start taking stress, the moment you are having not good sleep, or the moment you're not eating well because of all the anxiety or stress happening around yourself, your immunity goes down. When your immunity goes down, you're more at risk of catching the infection. So first thing you have to understand, you have to do everything, whatever you do, considering everything is good around you. So first thing, proper diet, nutritional diet. That is very important. Balance between your work and personal relationship. This is very important. Not working too hard where you're burnt out and you can't do anything. This is something which is not acceptable. So having a balance in your life. Having a third thing is having a good sleep. This is again very important. Sound sleep, 6 to 8 hours, 7 hours is something which is essential because it fills you with positivity. It gives you a positive energy to kick off your new day with freshness, with a different perspective, and you can deal with the life challenges in a better way if you have a sound sleep. So this is third most important thing. Fourth most important thing, which is like your physical, your workout, your exercise, because even I have seen like during this lockdown when I was speaking to different groups as well, I was stressing about the exercise. And I have recently came across one research where there was a study, a massive study which happened in Taiwan. And they have quoted that you don't have to do a workout for 45 minutes or 1 hour. Even 15 to 20 minutes of regular exercise is more than enough to give you 3 years of life expectancy, additional 3 years of life expectancy, and also it cut down the death rate by 14%.
Wow.
So that means you don't need fancy gyms. You don't need any special time. It's just 15, 20 minutes. And trust me, whoever say I don't have time for gymming, I don't have time for exercise, this is completely wrong. This is not acceptable because that means you don't love yourself. If you don't love yourself, you will definitely not you can't love anybody else. The first thing is if you don't love your own self, you can't do any good to others. So
Exactly.
please, you have to find time for your exercise. You have to find time for your diet. You have to find time for your giving time to your friends and family members. This is fifth very important thing, that speaking to the people around with whom you have a trust, with whom you feel being shared, and with whom you can share and release or let go your feelings. It's very important to have regular conversations. Lot of mental health issues can be overcome just like speaking to others. Just speaking to others. You don't have to do anything. You don't have to go to the specialist. But at the same time, if you're struggling, if you are staying alone, if you don't have a relevant support group, if you don't have friends and family, or that loving relationship where you are struggling, even to somebody to listen to you, there is no harm to show that courage, to escalate and to get a help from the specialist and get yourself sorted. There's no harm. So leaving apart all the social taboos, because you're not doing for others, you are doing for your own self.
Yes.
Life is precious and you have to embrace every moment. And if you think you're struggling, your negativity is impacting you, please go ahead, get a relevant help, sort out yourself, make difference in people's life. And this is what I want to tell to people.
Wow, thank you. Thank you so much for that. You know what? I got two questions to
Mhm,
ask you from what you just said so far.
mhm,
You see, in counseling, we whenever we have a client, you understand, and from their life issues that they're telling us, you understand, we usually kind of like sometimes we use psychodynamic, which is like going to the history,
mhm,
to the roots of the
mhm,
problem. You understand? So
mhm,
I find out that most people who abuse other people, you understand, they
mhm,
have an issue, which I believe you just mentioned as well. You
mhm,
understand? They have an issues growing up. That's why they don't know how to show love to other people, and that's why they abuse other people. I
mhm,
want to find out how accurate is it, because sometimes when I'm discussing with people, they're always like, you know what, it's your choice, it's this, it's that. But the thing I want to find out, what happened in the past, can it affect the future?
Absolutely, Bukky. Your mental health is the outcome of all the things which have happened in your past. What you are today is the outcome of everything which has happened in the past.
Mm.
Okay. Now, even like if we see about the personality disorders, like most of them, and even a lot of mental health issues, they are actually running in a family as well, because there are certain genes which are linked up with your mental health disorders as well. So if your mother, like if there is somebody with a family history of any psychotic problems, there's a high risk of even that child to have that psychotic problem because that is genetic. Okay,
Mm.
so this thing happens, and something secondly is like which you acquired throughout your life. Like for instance, it was like you were born completely normal, things were absolutely fine, but you have seen domestic violence in your family, you have seen a lot of mental health issues in your family that in turn impact your mental health. So
Yes,
obviously what you are today is the outcome of your past,
exactly.
and that outcome is basically that includes everything, your genetic makeup as well as the environment where you have brought up,
Mm.
and it is all crucial and that is reflected in your behavior. So this is very important, but again, as I said, if you have a loving relationship, if you have a people to speak about these things, I think a lot of things can be addressed in a very better way.
Yeah,
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 yeah.
exactly, exactly. And what is it called? Okay, for people, maybe children who are in the home with the parent right now, whose parent, they're always like saying negative things to them, or maybe the wife or husband, that the wife is always saying negative things to them. How can they, help themselves in order for them not to have mental health challenges, maybe now or later in life? How can they, help themselves? Because the thing is, we all have different ways of, because the thing is, from what we've been discussing so far, there is no way that when children are born, you understand, they are born so perfect. You understand, they are like all so perfect and everything like that. But like you said, growing up, seeing whatever is happening in their family, what is happening in their mom's, dad's life, and everything like that, they start building up on that. You understand, and that's why I say that all human beings in the world, I don't know how accurate this is, but this is from my own from my own research. I find out that every one of us, we are in a way mentally distorted. You understand? It's just the way we handle it. You understand? That's what makes us to be maybe stronger or whatever. So I want to find out, children who are going through abuse from their parent, wives, husbands who are going through abuse from their parent, especially with this lockdown that we have, you understand, even though it's easing up, but not completely, you know, so how can they deal with it? What can they do? Is there any resources out there, any information out there that they can, they can seek or something like that, someone that they can talk to or something like that? And what can they also do in this kind of situation?
So that's a very pertinent question, Bukky. And I always feel like being a neonatologist, I always take it a pride to say that having children or having a kid is a blessing.
Yeah, it is. It is.
Please don't take it for granted. This is
Mm,
the first thing I would like to say to those parents where domestic violence is a part of, their relationship, and they don't care about the kids who are actually observing that. Please don't take these children for granted. This is first thing which I'm going to highlight to. This is a very sensitive and a delicate age where whatever children see, they imbibe those things, and it impacts to them to the extent where if these things are very frequently being encountered in their family, these are the people, these are the kids who later in their life, when they grow up as an adult, are the one who are more into antisocial activities. Okay, because this is one of the part. And when we talk about even radicalization, like we as a healthcare professionals, we do a lot of courses in radicalization where it's all about like somebody becoming radical and going and joining some other extreme groups and doing some sort of antisocial activity. These are exactly the same kids where these problems were basically witnessed by them for their during their childhood, or they came across. And because of what happens when they don't have a very loving relationship or that trustworthy relationship with their parents, they basically are more inclined towards their friends.
mm,
And again, the peer group, again, it matters, like, because there's no one to tell them, like, that what is right, what is wrong, because the parents themselves are not in a position to focus on their kids. And that's why these kids are basically with whom they're growing, what are their peer circle. There's no one to have a check on them.
mm.
And that's why there is a history of substance abuse and lot of things like substance abuse being radical, like getting influenced by some of the negative thoughts and doing something which is antisocial. These are something which is very, very commonly seen in these kids later in their life. So I'm not surprised. The first thing, the most important thing to the parents is, please don't take your children for granted.
Mm,
Giving birth to a child is easy,
mm.
but actually rearing them and taking the responsibility by being a responsible parent is very difficult.
Yeah.
And that is very, very important. Like I'm always quoting my example, like whenever me and my partner we fight with each other, I always say, if my kid is there, this shouldn't be happening, because I don't want my kid to see all these things. And that's why we try to fix it and resolve it. And because we have to constantly make ourselves aware of that somebody's watching us,
Mm,
somebody is looking at us.
mm.
Either we should have an adult talk where we can go to one side or maybe in another room, have a discussion, sort out everything, but not in front of the
Yeah.
kids, basically.
Yeah.
If these things are adopted by the parents, that would be the most ideal, more mature way of dealing and negotiating, and as well as making some sort of arrangement in order to get through that difficult time or whatever misunderstanding is there to clear it out, but not letting your kids to get affected by that. So
Yeah.
this is the most sensitive advice which I would give to everyone, because Bukky, I've seen so many parents like who really want the kids in their life, and their child is being born with this problem, that problem. So having a normal child is a blessing.
It is.
Don't take it for granted. There's so many people right now undergoing infertility treatment, IVF pregnancy, wish to have babies, but they're not having. So please, those who have got, please don't take it for granted. This is the first thing. As far as the health and other thing is concerned, what they should be doing. So again, it's again a joint decision between a couple that first of all, they have to understand there is a problem. Yeah. They have to first address and accept or acknowledge that there is a problem in their relationship. That is first thing. Once they have acknowledged that this is a problem, they have to think, what is the way to address it? Is there anything they can do between themselves to resolve it? Or there is a need to involve a third unbiased party where the role of specialist comes into picture. Okay. If they think that they have done everything by themselves, it's not happening. And I'm not saying that it could be a specialist. It could be your parent, one of the parent with whom you have trust. But again, the parents might be biased based on whether he or she is his daughter or son or whatever. It has to be somebody, a neutral person, because so that at least he's non-judgmental and he can analyze the situation, he can give some different perspective, and the couple can work together on it. And sometimes it's really very, very helpful. Okay. So first thing is you have to understand whether you can fix the problem. You can first acknowledge the problem, whether you can personally fix the problem. If you can't, contact the specialist, get a relevant help, and see whether it is working or not working. The first thing, the most important is not to suffer within yourself. If you think any relationship is making you choke or making you suffocated, that's not the right thing. That means you have to do something. The only way is fix it, solve it, and move ahead, or scoop and run. That means it's not working. Because you can't just keep on having those negative feelings again and again around the bush. You're just going and you're just trying to fix it, but nothing is in your control. You can't let your entire life to have that heavy negative feeling for the rest of your life. You have to release it. So first find the problem and acknowledge the problem. Try to work on it. If you think it's not working, specialist. But again, Bukky, there's a lot of website. If you go on NHS website, there are a lot of things for the couples as well as even the GPs are there. You can contact with your GP. You can say that you need some counselor or something. Even there are some private counselors as well where the people can go. But all the information is there. And these days, everybody is first Googling and then coming. Even like I find it very challenging. When the parents are coming to me, they have already done a good Google. They have already considered Dr. Google, and then they come up with their questions and they ask me those things which they have already discussed. It's very challenging for me as well.
I know.
So everything is available on the online, but it's a matter of that whether you really wanted to work towards that relationship to get better in order to protect your family, in order to protect your kids, or you're not happy, or you think that breaking the relationship probably would be much better because you're struggling, you're not able to cope up with that. Because again, you have to think of from a longer perspective as well how much impact it will cause in your kids. It's completely a couple choice. Completely a couple choice.
Okay. Some of this information or the resources through NHS, are they free service or?
Yeah. There are online there. If you see, there are helpline as well where you can freely talk, because even during the COVID situation, they have literally opened a lot of helpline which is free. The psychotherapists are online. You just have to give them a call. Yeah.
Okay.
Unfortunately, I haven't got that all right now. Otherwise, I would have shared all the viewers.
Google it. Google it. That's what Google is
But
about.
it's definitely online because during lockdown phase, this was all being circulated to all the healthcare professionals as well. The online services are there. Anytime anyone is feeling anything, these are the helplines where people can contact freely. Even the healthcare professional can contact them freely.
Okay. Well, thank you so much for that information. My next question is, what are the signs and symptoms that one should not ignore? And also, when experiencing all these signs and symptoms, how quickly should one seek the advice of a doctor?
Okay, so as far as the signs and symptoms is concerned, Bukky, obviously, as I said, there were 7 spectrums of mental health disorder, which I have spoken about. The first important thing is when people have mental health disorders, the first thing, the change which you see in their personality is quite obvious. They behave the way they are not like, they behave in something very unusual. Like for instance, somebody who is like very socializing person, was love to talk to the people, all of a sudden started remaining within himself, stopped talking to the friends, stopped meeting the friends, going out and becoming social. So there's definitely a subtle change in their personality which you can see. Okay. Sometimes they will be very outspoken, which they are not. Sometimes they'll be completely shy, which they are not. Okay. So these things you can see. Sometimes you can see that either they're sleeping too much or they're not sleeping at all. Either they are eating too much or they're not eating at all. Okay. Or sometimes they're just having constant low feelings about worthlessness, hopelessness, that, I'm not worthy enough, I can't do this thing. And this is just not there on one day. This is persistently, it is there persistently in their thoughts. So these things are completely happening again and again, reoccurring. These thoughts are completely reoccurring again and again in their thought process. Other thing could be, you can see the substance abuse. This just started drinking too much. This just started smoking too much. That means something is not right. Like, these are very subtle signs where you can see an obvious deflection from their normal personality trait, and you can see them doing something which is not their usual type. Okay, so this is something which you can always, and if we speak specifically about a psychotic problem, that's a different thing. That they are getting hallucinated, they are having delusions, they can hear some voices, they are seeing something in front of them. This is completely a psychotic behavior. Okay, and that is very, very obvious to anyone to understand that there's something wrong with this person. Again, Bukky, I'll not say what is the right time because it's completely an individual perspective. I would say early is always better. Yeah, as if there is anything, then early like involvement with the specialist or with support group or with somebody is always better, because a lot of time if these things are left without being addressed for a longer time, because that person is already suffering or is unable to cope up with the life stress within himself, he might take a very unacceptable way of releasing that thing, maybe by committing suicide or doing something harm to himself or doing something which is not acceptable. So again, it depends upon, if you think that you have seen something in your friend which is worrying you, it's always good to have, either if it is possible, if you think that person is still in that state of mind where he can understand what you're telling or what you're asking to him, it will be always better for that individual or a family member or a friend to have an open conversation with that person, that what is wrong? Is there anything I can do? How are you feeling? And these kind of things, because these are very important. Like, not saying that, I'm not saying that you should be saying that what is wrong with you, no, not saying that.
Yeah.
Like, is there anything is bothering you, is there anything I can help you with, these kind of like compassionate and kind words with that person. If he or she expresses, then please listen. As I said, the only thing which I think which can prevent a lot of tragedies or people committing suicide is by being a good listener. When you listen to them, they will open their heart, because they are actually in need of a true friend or true family who can just listen to that person and let them go their heavy heart, let them go their feelings which are being accumulated and they are struggling with that. If that thing you think that is something which probably with a conversation you can help you with, then you can organize some couple of conversation. You can check with that every day on a regular basis. How are you feeling today? Did you have your good meal? What are you doing today? Can we catch up for a coffee? Like, these kind of things, which can be easily offered from the family or the friends. But if you think this person is completely closed, like he or she is not ready to open up anything, and you think that something is not right, either you can speak to anyone who is close to that person, maybe his or her wife or husband or mother, father, brother, something. Or if all these things are not even working, then obviously you can always check with them whether there's any need for any specialist, if you can provide them any help with them.
Okay.
So yeah.
Okay.
Bukky, I'm very sorry. I need to just switch on my laptop battery because it's gonna run off. Just give me 1 second, please.
Okay, that's
I'm
fine.
very sorry for that.
Fine.
Just very sorry.
Okay.
Where you yourself can offer the help, or you can ask any close friend or family to give the support. Or if everything is not working, then obviously you can always contact the specialist, or maybe you can share the number with the family member that this is what you feel, and you can constantly check on that person whether that person was actually being engaged with this with these specialists, or it's not being done, how the things are going, what's the progress, and these kind of
Okay, okay,
things.
that's really good. Thank you so much for that information. And one other question that I want to ask you is, I want to know what are the causes of mental health, challenges or mental health? Because the thing is, you mentioned about PTSD,
Yeah.
depression, anxiety. What are the causes of all this?
Cause could be anything, okay? It could be, for example, like it could be a social or financial circumstances. It could be anything like a biological factors, like anything to do with your health. Like, for instance, anybody who was a healthy individual all of a sudden came to know that he has got a cancer, or something which is like a life-threatening problem, or something like multiple sclerosis. A lot of women, they have multiple sclerosis or some rheumatoid arthritis and these kind of things. which is like a lifelong thing which they have to manage and they have to accept those things. It
Mm.
is something like which is like unexpected, but when these things happen, it definitely hides a lot of anxiety. And even if you see that almost all the cancer patient, if the major problem with the cancer patient is not about the disease per se, it's majorly about the depression. Yeah,
Yes.
this is a very common thing which you come across. So these are all biological factors where your health, you have some health related issues which can cause this mental health problems. The
Mm.
other thing could be lifestyle choices.
Mm.
So as I said, the peer group and substance abuse and eating subconsciously, you're sitting, you're doing your 8, 9, 10 hours of your job, you're just sitting and on computer, subconsciously you're munching and eating junk foods. These are all lifestyle choices which you make.
Yeah.
These all, like your social, your financial circumstances, your biological factors, your lifestyle choices, they all shape a person's mental health.
Mm.
Okay. And then again, how you are in terms of your like how you cope up, how well you can cope up with your stress. If even a mind, like for instance, if the people with the mental health issues, even a minor stress can give a lot of anxiety to them, which a normal individual probably can deal very likely, even with it without getting bothered by that.
Mm.
So it's all about the way the circumstances around you and how you cope up with that, and your own perception, your own mental and physical well-being, which decide your mental health.
Mm. Wow. Okay. Thank you so much for that. Something just came on my mind right now. You see, like I said, in Africa, a lot of people they don't believe in this mental health challenges thing. You understand? So I want to find out. Do you think human being, you understand, people who are in the Western country, people who are in Africa or underdeveloped country, do you?
India. Please
Yeah,
don't exclude India.
yeah, India and everywhere.
Yeah.
Do you think we are different? Because we African people, Indians, we believe that all these problems, you understand, they are for the Western people. You understand?
Mm,
So
mm,
I want you to stress more on that. Even though we touch a little bit about it, I want you to stress more on that.
mm,
Because the thing is, when a newborn is born, you understand, they
mm.
come out with there's a little bit of they come out with blood, you understand, and they
Yeah,
come out with this white substance. I don't know what it's called, but you will know, you understand.
yeah, yeah.
And from your experience, you understand, all the newborn that you've seen, when they come out of their mother's vagina or whatever like that,
Mm.
they come out with same type of blood and
Mm-hmm.
same type of that white substance.
Vernix. That is called as Vernix caseosa. Yeah,
Okay,
Vernix. Yeah.
good. I don't know what to say, but thank you so much for that. And so I want to, we so looking at it, we are all the same. You
Mm.
understand? So for hers in the underdeveloped countries to be saying that, you know what, mental health challenges is not for us. We are stronger than that. I wanted to put it out there, you understand, and let people know that we are all the same. And
Yeah,
we all go through life stress, you understand?
yeah,
And
yeah,
stress is what actually cause all these mental problems. But
yeah,
like we've been talking about, it's
yeah,
how you deal with it.
yeah,
It's how you
yeah,
address it. It's how you voice out. I
yeah.
want you to put the word out there. You understand? Are we all the same? Do we face the same mental challenges?
So, Bukky, first of all, like ethnicity, your background, or these things, it doesn't matter. Mental health can affect everyone equally. Okay. Obviously, in back in our home country, we have a different issues like poverty and another thing, like because of the poverty, like illiteracy and these things, there are other problems or health conditions which is quite often seen in Africa as well as in some parts of India. So these are something like obviously the problems which are being faced in the Western countries or the developed countries completely different with the problems which we face back in our country.
Mm.
And I feel because we went through so much right from our childhood because of all these things happening around us, somewhere I feel that we are probably more strong in terms of when these challenges comes up in front of us. I feel that probably we are more strong. But again, there's no difference in terms of you being born in India, Africa, Europe, or United States or UK. There's no difference. Mental health can affect everyone equally. Yes, the causes could be different. Okay. Causes probably in Africa or India could be because of financial constraint, because of illiteracy, because of all the things which could happen because of poverty, low hygienic condition, and having malnourishment or scarcity of food, people stealing the things in order to, take care of their family. The things and the causes could be different.
Yeah.
Okay, the things which could lead to the mental health issues could be different. In Western world, it could be maybe obesity. If you see America, then it's been very if you do the research, 1 in every 5 individual in America is suffering from depression or mental health issues, and it's a big number. Like 1 in 5, that means what? Like it's a massive number.
Yeah,
Okay,
massive
so
numbers.
again, like with them, it's a different causes. Like for instance, obesity. Like for instance, other things like they have got a lot of issues here and there. And obviously, the first cause is obesity and depression, which is like a prime thing in America.
Mm,
So it could be genetic, it could be the environment, it could be the eating and the lifestyle choices they have made. So causes could be different in different country based on the how the countries are doing from wealth wise, from the exposure wise, from the education wise, from the money wise, and everything. But mental health issues is quite like it's uniform. It could happen to the same extent irrespective of your ethnicity, irrespective of your skin color, irrespective of wherever you were born. It impacts every individual to the same extent. Where obviously, if you have some underlying health condition or already underlying mental health issues, it will be heightened to a more severe stage as compared to any normal individual who is born healthy, who is not having any health condition, who is otherwise fit. Probably he will handle the similar situation in different ways. So there's no difference. There's no difference between how the people or to what extent these things can affect the individual based on the country of origin. There is no difference like that.
mm, wow.
But there are some modifiable and some non-modifiable things which people can consider. Like non-modifiable, I can say that you have no control over your ethnicity. You have no control over your sex or gender, basically. You have no control over your age. So these are something which is non-modifiable. You can't do anything about that. Yeah, to address your mental health issues. But the things which are modifiable are your socio-economic condition, your occupation, your housing condition, your education, your personal level of involvement with the social things, your commitment to your friends and family. These are all modifiable. Okay. So the only thing you can do is the modifier. You can only act on the modifier, but you can't control where you're born, what is your skin color, what is your ethnicity, what is your sex and gender. These are all non-modifiable things.
Mm.
Okay. So yeah.
Okay, well, yeah. Another question that pops on my mind right now is, you
Mhm.
see, this mental health challenges thing, we hear more about it in the Western country
Yeah.
than in Africa. You understand? So I want to find out, are they more aware of mental health challenges than, I mean, the Western country, people in the Western country, are they more aware of it than, people in Africa? Because the thing is, I believe that mental health challenges should be more in
Yes.
Africans or underdeveloped country. Because
Yeah.
why? Like in Africa right now, most people, they don't experience stable lights. You
Yeah.
understand?
Yeah.
Electricity, and there is poverty. There is so many things going on.
Yeah.
So with that, they still don't. We don't hear a lot about mental health challenges there.
Yeah.
So
Yeah.
why is it that there's more about mental health challenges
Yeah.
unlike it is in Africa?
So, Bukky, if you initially you said about the condition where you said that probably back in Africa, when you speak to any of the people that I need this thing, and they just look at you that there's some major problem with you, because there's a social taboo always. Okay, obviously in developed country, as I said, when I came to UK, I saw that people are very extrovert. They are like they have no restriction or reservation in saying that I have a mental health issues
Mm,
and I am dealing at the moment. I'm going and I'm getting some counseling sessions. They don't have any reservation because this is being openly provided to them,
mm,
and they have seen even when their auntie or their friends or their mother or anyone who had these kind of challenges, they have also done the same. So
mm,
it's something like not unusual thing for them. Yeah. But if we see it back in our own country, obviously the first thing is like we have different issues. Like mental health is like something people say, yeah, he's very stressed. You know what? Because his family is not doing great. He's not earning. He's unemployed. So our focus is unemployment. Our focus is poverty. Our focus is completely different. We are not thinking that how much these things are actually impacting our mental health. Okay.
mm,
And at the same time, if we see back in home country, obviously these days people are like, there are psychiatrists, there are psychologists, you can speak to them. But nobody is actually like, hardly few people are going and openly saying that, that I am actually taking a session, because people are like quite conservative in their thought process, first of all. And secondly, like these are the only people who are like educated,
mm,
who know that, okay, these are the services which are there. And probably if I go and have a conversation with them, I can get the support. These things are not even aware to the people who are below socioeconomic strata, who are poor, who are uneducated. They are not knowing even there are special. They can't even manage their one-time food. How can they afford even to going to the psychologist to speak about that? I'm hungry. I'm
okay.
stealing the things. I have this mental health issues. I am antisocial just because of the outcome of the circumstances which is going around me.
Mm.
So it's completely different. We can't compare our country with a developed country. Obviously, the things are changing now.
Yeah.
Everything is changing. India is developing so much that I can see. Africa is developing so much. Everything is getting better. What it was like 50 years back, things are, and even the perspective of the people are changing now. But still,
Yes.
we can't ignore the fact that we are still facing poverty, illiteracy as a major thing. And until these root causes are not being addressed, it's very difficult for any individual to even seek any help to address those conditions or
Yeah.
mental health issues.
Yes. Exactly.
Yeah.
Exactly. Thank you. Thank you so much for clarifying that.
It's not a crime that you born in Africa, I born in India. That's absolutely fine. Today we are in England right now. So let's do something here.
Yeah. Yeah.
But
Okay.
definitely we have to keep our mission going. We have to help our country as well. We have to help
Exactly.
our countrymen as well, because these
Exactly.
things, if we know that these things are very prominent in Africa or India, as I said that whenever I go for any Indian conference, my first focus is not to just deliver the talk on the neonatal topics. I
Yeah.
always take a time out. I speak to my seniors, my colleagues, my juniors. I always and always, even like this time when I visited my home country, like my hometown, I went to the medical college. I met the head of the department. I organized a teaching for all the medical graduate and postgraduate and the senior professors who were there. And it was all about mental health issues.
Yeah.
So I don't want that, my efforts are just here for some, like right now we are talking to each other. I want it to be spread. And if we are gaining something good, which I have seen in NHS, I would definitely want to take it back to my home country so that my people should also be getting benefited by that.
Exactly, exactly.
Yeah.
We need to create that awareness because the thing is, like we've been saying, everyone in life have
Yes.
we all have to deal with mental challenges, no matter
Absolutely.
how perfect you think you might look. You understand?
Absolutely.
So I would love it if it's being incorporated in all areas. You understand? In
Absolutely.
all profession,
Yeah.
medical profession, whatever. You understand? Because the thing is, you have to discover yourself. You need to know about your past history. You need
Yeah.
to know why you're doing what you're doing. You understand? So that you will not continue to be, what is it called? Being bad to other people, or
Yeah.
not showing love or care for other people. You understand? So government, they need to put the word out there that no matter the profession you're going into, you have to first of all go for mental health training. You understand?
Absolutely. And yesterday also, like I was very fortunate to speak to one of the doctor. And that was just because one of my colleagues' father was very serious and he was admitted somewhere in one of the part of India where I didn't have any connection, but I just texted in one of the group WhatsApp group and I came to know about one of the doctor who
Yeah.
was like very prompt to give me support. And actually he directed me to another lady doctor who was actually working in that hospital.
Yeah.
And leave about like what information she gave to me about that patient. When I was just listening to her, she was speaking to me. She was speaking so fast, and she was like looking so stressed to me. I said to her, "Are you okay?" Like I said, I can completely understand. Like first of all, like I got all the information about the patient about whom I was asking, so I got that. But at the end, I asked, "How are you feeling today?"
Mm.
Because I can sense there's a lot of stress. And then she just opened up her heart. And what she said to me was like something very heartbreaking for me. She
Wow.
said to me that she's a mother of 2-year-old
Mm.
and her family is somewhere else. She's currently posted in a COVID ward where she's treating all the COVID positive patients who are like moribundly sick on ventilator and those things.
Yeah.
And for almost a week, she hasn't seen her 2-year-old because obviously she is staying in a different place so that she shouldn't inadvertently, being a carrier of corona, pass it to her child.
Mm.
So she was away all alone on herself. And even she said to me that, we are wearing PPEs here and when we are going inside. And obviously the PPEs, every country has got different PPEs. And like in India, the one which they're wearing is completely jam packed. Like you have nothing, there's no space. Like you're wearing completely like a jumpsuit
Wow.
and which is like till here. And then you are wearing your mask and your
Yeah.
goggles and everything, visor and
Okay.
everything.
Okay.
So she was like, at the end of 2 hours, when you're inside, you feel like completely drained out. You feel like drinking water, but you can't because unless until you have changed your PPE, you came out, you have dumped everything, you can't do it. And
Mm.
it's so traumatizing for me. And I can understand, and I felt really sorry. And the only thing I said to her was that, please take it easy because this time is not permanent. I can completely understand that anxiety is being heightened up because you are staying away from your 2-year-old. And I can completely understand. And I have a massive high regard to you, what you are doing right now. But the first thing you have to understand, you're a healthcare professional. You
Mm.
have to take care of yourself because a lot of eyes are looking onto you. They are actually expecting guidance from you. So if you are getting affected, obviously you'll not be able to give those kindness or those comfort or those that management specifically with a sound mind, which they are expecting from you at this point of time. So I said to her about just doing some breathing exercises, just keeping herself calm, drinking lots of water, healthy nutrition, having sound diet. But at the end, she was so happy, and even like we shared the number, and I said to her that even if you can't, if you are if you need anybody just to talk to you, please text me. Obviously, I work in the hospital, so it will not be possible for me to immediately respond to your call. But you can always leave me a text. I can always respond you back. But don't feel that you're alone.
Wow.
And I felt like really like, when I said those things, I don't know why I said that, but I just thought like just spending 5 minutes more because she gave me whatever I wanted to listen. But at the same time, somewhere I felt that this is my responsibility that I should address this thing because I can sense the way she was speaking to me and the way that she was giving me the information. She was so stressed out that I can completely make out with the speed with which she was speaking to me.
Yeah.
So there are subtle signs which you can very easily pick up from the people when you're speaking to them. You can completely pick up the point that there is something wrong, which is
Yeah.
not right. It
Yeah.
could be stress, it could be anxiety, it could be something more.
Mm.
You have a responsibility towards every individual with whom you're talking.
Mm.
Never think that your life is just about you yourself. It's about the more you give, the more you get, and this is how the universe is being made. So you
Wow.
have to keep on giving your positivity. You have to make difference in people's life. And I think, and that is why I have a high regard for my profession. I'm not saying any profession is less or more
Yeah.
than being a medic, but at the same time, I think because these privileges and these opportunities are quite often on our platform to give and serve, I think that's why I take a high regard of being a healthcare professional.
Wow, wow. I don't know. There's just something about you that I just like. Your perspective about life, your perspective in your profession. They
I've been through a lot, Bukky, to be here.
really,
I've
maybe
been
that's
through a lot.
why.
I've
Maybe
been
that's
through a lot.
why. That's why. See, sometimes it's good to go through adversity in life.
Yes,
You know why
absolutely.
I say that? Because when you go through stuff in life, you'll be able to relate to other people. You'll be
Yes.
able to know how to talk to other people. You understand? Because a lot of people in your profession, what you're saying right now, they don't care. When something happened, you would not believe the way they'll just pass on the information. Oh, you know what? This happened, and it's out of my hand. There's nothing I could do, in whatever, into maybe what is it, to recover the person or to do something to the person. So I don't know what to do. Just do whatever you can do.
I think Vicky, it's very important, like as a healthcare professional, you have to be assertive about your decision, but at the same time, you have to be kind. But sometimes what happens is if you're too kind, then people do take an undue advantage of that because they think, okay, she's soft, she can be easily, can be dealt with. But I think never let anybody to take you for granted. This is first thing. You have to define your own boundary. You have to be assertive. You have to be professional. But at the same time, you have to understand the person who is there in front of you is also another human being.
Mm,
And what you're gonna give to that person is the same thing which you're gonna get back. So you
mm.
have to be really careful. You can't just keep on saying that this person is bad, this person is bad. Sometimes even I'm not saying I'm perfect. Like literally,
No.
sometimes even when I come back, I say to my partner as well, this thing was not good. And then I think, okay, fine, this is not there. And every day when I go back, I don't want to go with a similar heavy heart to my work again, thinking that the things are like this and that. No, because if I'm going to constantly moan about these things, which is like not in my control, probably it will affect me. It will affect the fun or the things which I am doing in my regular life. It will make my work very monotonous and it will not give me enjoyment. And the first thing is I have to enjoy my work because it is me and my time and my life which I'm investing on this job. It's
Mm,
not the job which is priority for me. It's
yeah,
my life, my time, which I'm investing for this job.
mm,
And sometimes what happens during our journey, like in our life journey, we forget that job is just a part of our life. It's not the only life.
mm,
So most important thing to understand is having a balance, a right balance of your personal relationship, of your physical workout, mental well-being, social well-being, everything is what decide your health and what decide your professional ground as well. Because health is just not about having no disease. Health is all about your mental, physical, and social well-being. Even you're mentally good, socially good, you have no connection, no friends, it will impact your mental health, it will impact your physical health. So you have to ensure all your mental, social, and physical well-being has to go hand in hand. Anything which bothers you, have an open, transparent conversation, deal with it. If you think this is something like you're in a challenging situation where you can't deal with it or you can't be so expressive, at least express to somebody who's close to you so that at least you'll feel that you have actually let go that heavy heart. Maybe like you may not find the solution at that point of time because sometimes the culture is being adopted so hard by, or the things which is going in the system is like the roots are so deep seated that you can't do anything to make change. But trust me, if you're consistent with your effort, one day the change will definitely come. But the only thing is, I find it the only way to actually look forward to life, or to make your work culture or make your life more fun, is managing human factors. And that's why when I go for my work, the first thing which I do is just managing human factors. If you're very good and expertise or skilled in managing human factors, everything is being sorted. There's no difficult colleague, there's no difficult person, there's no bad person, there's nothing called, somebody is trying to be like cheeky on you, or you're just, there's nothing like that. It's all about human factor. And the good leader is the one who can manage those human factors. And you need to have those leadership skills. If you don't have, then obviously, if you're not struggling at this point of time, at next step you'll struggle. If you're not struggling in next step, you'll struggle in third step. So it's all about having those tactics to deal human factors and making your way and taking your life in an optimistic way.
Yes, exactly.
Yeah.
Exactly. Thank you so much for that. Let me just go to my next question. You see,
Yeah.
every one of us, we all have the ability to build mental strength, but most people don't know how. You understand? So, and we spend a lot of time, talking about our physical strength, our physical health, and but we spend much less time on our mental health. You understand? So, and we crave so much about, I gotta get this gym body. You understand? We think about about exercising to just get the perfect body and everything, but we don't really take so much time on our mental health. You understand? Because looking at it, I think if you spend maybe 1 hour taking care of your physical health, you should be able to spend about the same time or even more time on your mental health. So I want to find out what is important more. You understand? How do we take care of our physical health and also our mental health? And I mean, is it important to take care of the physical health more than the mental health?
I think, Bukky, if you see, like, we are quite a lot impacted by the social media. And if you see the social media, like these days, we are quite open and honest in talking about the mental health issues. But if you analyze the situation 5 years back, or maybe 6 years back, or 10 years back, there's no discussion. It's always gym, body, diet, and this thing, not to eat this, not to eat that. No. But the first thing is, if we start making people to understand that health is just not about being physically fit. Health is a component of social, mental, and physical well-being. When they acknowledge that there are three basic domains in order to be healthy, in order to be said to be that you are well, it's like three domains are there. And if you specifically spend time to address these three domains, then only you are said to be like perfectly well enough in yourself. So it's important that we should acknowledge and we should make people understand that mental well-being, social well-being is an essential part of you being healthy. Okay,
Yes.
which is only in last few, maybe I can say, through our social media platform, when I'm speaking to you or with other groups and organizers, where we are openly discussing about mental health issues. But previously it's not. Even on Facebook or any of the social media, if you go across, you'll always find somebody doing some gymming, somebody doing some exercise, somebody showing some pills to reduce the weight, somebody showing something else. Why these things are needed? As I said, it's only 15 to 20 minutes of stretches which you need in a day in order to be healthy.
Yeah.
But this is again one essential part of your well-being. The two essential part of your well-being is still missing.
Yes.
You can't ignore your mental health, because your all hormones, your all things, your brain is an essential part of your body.
Mm.
Every hormone, whether you'll feel good or bad, is actually coming from here. So if you're thinking, if you make this thing pretty, but this is not working here, it's of no use.
Yeah.
Yeah. Because a lot of good faces, like beauty faces, like beautiful faces. If you see their intelligence, if you're not impressed by their, you will, oh my goodness, she's just, So it's all about addressing and acknowledging that your mental health and your social well-being is a part of your health. Unless until we do that, nobody will ever consider this, how essential it is to be healthy by focusing on these domains. It's very important, and this is our responsibility to make people understand what we.
Wow.
Yeah. And in order to address that, as I said, it's all about having a balanced diet, good sleep, good exercise, loving relationship, making a balance between professional and personal life. This is all about that. And if we have control over all these things, definitely your mental health is being taken care of, your social health is being taken care of, and your physical health is being taken care of.
Wow, thank you so much for that. Actually, I was about to ask you, what are the effects of eating healthy
Yeah.
and thinking positively, and also sleeping at a regular time. And that was the question I wanted to ask you, but I want you to, stress more and just be more elaborate on it. Like, I want to know the effects of, when you eat healthy, when you think positively, what effect can it have on your mental health challenges?
So, Bukky, there's a lot of research which is being happened about even, I don't want to comment about it being vegetarian or vegan or non-vegetarian because I'm a vegetarian.
Mm,
But I don't want to say that, eating non-vegetarian food is bad or being vegan is good or bad. I don't want to comment on those things because
that's
obviously every nutrition has got its own benefit. And obviously being vegetarian, also there are some drawbacks because obviously you're not eating your protein reserves and your B12 and all the vitamins, which is very rich in the animal diet, is something which is not being like easily available for the vegetarian people, and they have to ensure that they should eat variety in order to meet the requirement. But if you see a lot of research about the diet, they have said whatever green if you eat, that has got a positive impact on the mental well-being. Anything green is green, even for the health.
okay.
Green signal is like that means fit to go, ready to go. In the
Okay.
same way, anything which is green is something which is good for your health.
Mm,
Okay.
okay.
But again, it's all about having a balance of a nutrition diet, like having little quarter of your carbohydrate, more quarter of your protein, less like a portion of your fat,
Okay.
but with a combination and variety of everything. You have to ensure, even if you're vegetarian or you are vegan or whatever, you have to ensure that you should have a right balance of these things. Eating more protein in the daytime or in the breakfast or the lunchtime is much more productive rather than eating in the nighttime because again body takes its time to for the digestion as well.
Exactly.
And eating a variety, like for instance, I'm very fortunate that my better half is a Greek, and the Mediterranean food is considered one of the best food in the world, and that is for a specific reason because essentially their diet is a seafood, and also like they're very fond of fish and all the seafoods, which is rich in omega-3 and vitamin D as well. And on the top of that, if you see even the vegetarian option, the variety of food they eat more of olives, they eat more of roughage and fibers and those things. So everything is like, it's very healthy. And that's why it's important. When you eat healthy, you have better digestibility. Yeah. You have better digestion system. And obviously it is being absorbed in a proper way. And when you don't have GI problem or intestinal problem or constipation or bloating and these things, you feel more energetic.
Yeah.
Yeah. If you have a regular bowel habit, you feel more energetic. Yeah. So that's why it's very important to have a balanced diet. And when you incorporate these olives and a different variety, rich protein diet and these things, and as a regular basis, obviously it has got a very positive impact on your health. What you eat is what you feel and how you reflect your body. It's all about your diet is basically whatever you eat is something which take care of your health. And there's also something which is being said that if you see like a lot of research has happened about exercise versus eating, what decide your health, what decide your physique. And recently I read a very interesting article where they said even if you don't do exercise, it's if you eat healthy and in proportion, you'll never put on weight,
Mm,
you'll never have any problems or chronic problems. Because if you see back in my country, like even in India and Africa as well, majority of the people they have like a carbohydrate as a major diet. Yeah, even in India, like I see, and that's why the hypertension, like high blood pressure, high sugar level, diabetes, and these things, chronic illnesses, they are more frequently in those people where the carbohydrate is major portion of their diet.
mm,
So we have to ensure that we should be eating a very small proportion of your carbohydrate, maybe one third of your carbohydrate, one fourth of your carbohydrate, the rest, and or maybe one fourth of your fat, but rest has to be your protein. But a variety of the food has to be included.
mm. Okay. Well, that's good. So it's all
And
about,
and not to forget the fact, hydration.
yeah.
2 to 3 liters of water is something which is very essential. And irrespective of anything, you have to ensure that every day you should be drinking water because for better digestibility of the food which you're eating, you need water
Yeah,
as well.
it's very
So there's
essential.
no escape of water.
Yes. It's very good to drink water all the
Yes,
time.
absolutely.
Yeah.
I had one glass Bukky, but you are not drinking water since last 2 hours. I'm watching you.
I got it here. I just
Okay.
don't want it to be a distraction, because I'll be like, I want to drink some water, I want to drink some water, but I just don't want. So I got it right here. So when is your home water?
I am having here, like it's
Okay,
there.
let's have a water drink right
Yes,
now.
why not?
So water is very good, especially when it's very chill.
Yes,
Oh my God,
absolutely.
it's just gonna calm
Absolutely.
your heart, calm you everything. You understand? So water, water is very good. Yeah.
No, I don't want to be brutal on anyone just because I'm there in front of you. Please feel free to take care of yourself because this is the essential part, and this is why we are discussing today. that we have to take care of each and every component of our well-being, and eating habit, physical well-being, mental, social, all are a part of things. Yeah. And right now, what we are communicating right now, and the people who are watching us, it's all about we are getting connected with each other. That means we are socially we are taking care of our well-being. But at the same time, we are talking about a very important aspect of our health, that is mental
Yes, exactly. Thank you for putting that word out there. Thank you.
well-being.
Yeah, I promise that I won't take much of your time, but I know I'm like taking it right now because it's just interesting, and I just want you to just continue. But I know you're a busy lady, so we only have a few more questions right now.
Sure,
So I'll now
sure,
let you go. So
sure.
my question is now: this is based on your profession. This is based on your line of practice right now. So as you all know, we are in COVID-19, which makes everyone to quarantine at home and stay. We are all in lockdown. You understand? And when you are in lockdown, a lot of things happen. Like people, they get pregnant and everything like that, and they have to give birth. You understand? So I want to find out what is the best advice for you. I mean, to provide for a pregnant woman who are like, you know what? Oh God, I'm pregnant right now. How do I now go to the hospital? Because we know how the hospital is right now. A lot of people, even if they fall sick, you understand, they prefer to self-medicate at home. You understand, rather than going to the hospital in order for them not to contact this virus that is spreading and everything like that. So pregnant women out there, what advice can you give them in order for them to go to hospital for their regular prenatal checkup or something like that, or not to be afraid? Because the thing is, when they're afraid, it's going to affect their children,
Absolutely,
their unborn
absolutely.
baby. You understand? So
Yeah.
what assurance can you give them? What can what word can you put out there for them? You understand, in order for them to ease up on whatever fear that is on their minds.
So, first of all, Bukky, I wanted to first congratulate all the pregnant women that they are expecting their babies. The first thing is being happy, okay, for what they are being going through. And in a couple of months, they'll be a mom. So,
Yeah.
I would say, first of all, remain assured this is a very good news. You have to be happy. You have to cherish everything, because once the baby will be born, that baby will be crying. You have to change the nappy. There's a lot of things, so you can sleep, you can enjoy the music at this point of time. You
Yeah.
can let other family members to work for you. You can relax. So this is your time. So I would say, please pamper yourself. Have no stress of whatsoever,
Yeah.
because like any other problems, this is also something which is temporary, and this COVID situation will be passed soon. Okay, so not to worry about those things, but at the same time, being realistic about what is happening around. You have to be familiar. You have to know what is happening around you, so that you can get a best care for your own self as well as for the baby when the baby will be born. Now, the most important thing is obviously that my advice would be same as per the regulation or the guidance by the government, that please try avoiding going out if it is not needed. Try to stay at home, but at the same time, little bit of work around, and you have to find your time, like when you can go out and have a little bit of relaxation in the garden or somewhere with your partner and have a chat or something. So you need to find a way which makes you more happy, which makes you more comfortable, but at the same time, indulging in a little bit of physical activity is something which is good, but not going out too frequently, thinking that everything is normal, because right now it is not. So avoiding going too much outside. At the same time, washing your hand, taking all the precautions. This is all the general guidance which you have to anyway follow. Now, coming to the point that when you're pregnant, what are the additional things which you should consider? First of all, it's very important for you, if there's any sort of concern, if you have got that, you have to liaise with your maternity team or the midwife, saying that you have got this problem. Okay. Sometimes it's very easy during the pregnancy for the females to catch flu. Again, it's very difficult for us to differentiate between COVID versus normal flu, because the symptom could be more or less same. Okay. But so far, it's not very clear, like what could be, like how we should differentiate. But there are very specific features for COVID that will stop smelling like, if there's any specific smell, you can't smell that thing properly, and then you have a sharpness of breath or fever and those kind of things, which is very, very pertinent and specific for COVID. But if you have any concern, like a flu-like symptom, you have to immediately alert your midwifery team or your maternity team and ask for help. And based on their advice, it's something which you have to do. As far as the scan is concerned, obviously, this is a very important and essential investigation which has to be done, and it's unavoidable. For that, definitely you have to go to the hospital, but you will be going by yourself, because right now in the hospital, we are not allowing anyone to come along with them, because we are
Yeah.
just allowing them.
Mhm.
So I would say, take all the precautions, wear masks, keep sanitizers, and as much as possible wear gloves when you're coming there. But don't worry, even in the hospital I'm working, even, and I've seen everywhere, we are taking all the precautions in order to avoid too many people around. Even like if you're coming for your appointment, it's only one of you who will be there, or maybe second person will come after 1 hour something. So we are not allowing the visitors to be there in the hospital. So
Okay.
even though it's like hospital is considered as a very highly infectious zone and people are hesitant and afraid of coming there, but I wanted to reassure everyone that in NHS we are taking all sort of precaution in order to avoid the entry of unnecessary people. And if you are booked for your scan, that's absolutely fine because it will be taken care of. The person who is doing the scan will take all the care, measurement, and even wear the PPE if required. If you are suspected COVID or something, that person will be wearing the PPE. Or if it is not, then obviously we will still wearing a plastic gown and gloves and mask and everything. So these all precautions are being anyway taken care of. So don't worry about those things. I
Okay.
would say keep yourself as calm as possible. Focus on your sleep, focus on your diet because this is very important. Any inadvertent stress is itself a risk factor to precipitate any premature labor or labor pains. Please don't get anxious. Don't get anxious of whatsoever. But you have to be realistic. You have to know that this is the current situation around me. I have to protect myself from others. And in order to achieve that, you have to take all sort of precautions. But as I said, if there's any such problem, if you think that your symptoms are like corona or something is there, then obviously there is 111 which you can call for NHS to get a help because there's a COVID helpline which is there you can call. If you think there is something more you need immediate any something you went into labor or something happened, 999 is the emergency number. We can call, people can come and they'll immediately take you to the hospital. But these are all something which I'm just making you aware. But again, it's all about how you feel, how much calm and composed you keep yourself. That is very, very important. Just keep yourself relaxed. Just take all the precautions. I wanted to assure everyone that even if you're COVID positive, you might or might not pass this to your baby. Yeah. But so far, even like in my hospital, those babies who are born even to COVID positive, I have not seen even a single newborn being COVID positive.
Mm.
So first of all, for you to understand it, even if you have got COVID, there is no such literature or research so far or any sort of article which I came across that it is affecting babies' growth. So
Mm.
please, even if it is there, don't get panicked. Okay. So far, we haven't came across any baby being affected very severely because of COVID situation.
Okay.
Yes, there are different conditions where baby might need help. Sometimes even if they're COVID positive, I have seen one of the baby, like it was entire London, I think it was just one or two babies who were COVID positive, but they didn't require anything actually. Back in India, I came to know just a few days back, there was one baby who was like COVID positive, born to a COVID positive mother who required ventilatory support. But again, these are all like that was a premature baby as well. So this could happen to any premature baby anyway. So I'm not sure to what extent, and so far there's no literature being saying that, if you're COVID positive and if the baby is inside, like you're pregnant, it can affect the growth of the baby or baby will be born with any sort of severe malformation or dysmorphity or anything. So there's nothing such like things. So please don't worry about these things. The important thing is, please, if you have symptoms, alert the team, get a relevant support, speak to the specialist, and take necessary action based on their advice.
Okay, thank you. Thank you for putting that information out there. From what you just said now, I want to ask you two more questions.
Yeah.
Let's say a woman just gave birth right now and she needs to go to the regular, baby checkup or something like that, maybe for the baby to have the vaccination and everything like that. How should a woman, how should they dress the baby? Because, looking at it, I don't think one can put a face mask on a baby's face or put a hand sanitizer on their hands, you understand? So how should a new mom, you understand, or people who just gave birth or something like that, how should they dress the baby? What do they need to do, you understand, in order for the baby not to, even though you said the rate, I mean, the coronavirus affecting baby is not really like, so
Yeah.
bad or something like that. I mean,
Yeah.
even though I don't think I've heard about any cases of newborn having it anyway, but just to prevent the virus from spreading onto the baby, how should they dress the baby? What do they need to do? You understand? So yeah.
So far, the newborn babies are like blessed that in the entire part of the world, we haven't came across any baby being catching corona because of anything which is happening around. And obviously, we are very careful when we have a newborn baby. I
Yeah.
would say to those mothers, just be careful about your hand hygiene when you're doing the cares, when you're handling the baby, when you're breastfeeding. It's all about you taking care of yourself,
Okay.
not about how you're dressing and those things, because obviously that's the part. Obviously, you have to keep the baby warm, meaning you have to protect from others. But the most important thing is who is actually handling the baby. And
Mm.
it's all about your hygiene. If you are using, suppose, breast pump or anything, ensuring that that breast pump is constantly being cleaned. Okay, ensuring when you're doing the cares of the baby, changing the nappy, you should be like wearing gloves or using sanitizers, using wipes and those things. So it's all about hygiene,
Yeah.
maintaining a strict hygiene around the baby. And so far, like I haven't came across that any baby was brought to the vaccination, got COVID or something. I haven't came across any such thing. For some reason, for some weird reason, the kids are being protected. But recently in London, we came across like 6, 7 babies where they had some very atypical presentation as well. And that was something like a very atypical. There's another disease and medical term we call this atypical Kawasaki disease, where basically children, they have a high grade fever, some problems with their heart, and some skin peeling as well with some swelling. But that was a very atypical presentation which we came to, which we came across in the pediatric age group.
Yeah.
But so far with the newborn, I haven't came across any such thing. So please remain assured. It's all about your cares, how you're touching the baby, who is touching the baby. If you have anything, if you're sneezing, coughing, anything, please wear mask. And these are the only things which you, how by which you can protect your baby from. So
Mm.
I would say just take normal precaution, or just follow the government regulation. That is all is needed, not nothing major than that.
Okay, okay. And something just popped in my mind right now in regards to that hand sanitizer. You know, so
Mhm.
because some women they go out, maybe when they're outside, maybe the baby is crying and she needs to eat or something, and they need to breastfeed the baby. I want to find out this the hand sanitizer because it's got alcohol in it. You understand? How should they? What do they need to do in order for the baby not in the, maybe when they're breastfeeding, so that the baby will not be able to take in the alcohol? Is there anything? Is the alcohol is it bad for newborn baby? I don't know, but it's something that I see.
Yeah, like see, obviously, if there's a definite soiling of your hand because of food or anything where you have touched, you have to wash your hand.
Okay.
Okay. If your hands are otherwise clean, you have not touched anywhere. The sanitizers can be used 3 times. Okay, like once you have used, then maybe you need to do something. You have used second time, third time. But after third time, the sanitizer form a thin film on your hand.
Okay.
Okay, and if you constantly without washing hand, if you keep on applying sanitizer, it is not good. It is not good after 3 application of your sanitizer. So my advice is if you have used 3 times sanitizers, it anyway makes a film on your hand, which is not very protective. So you have to wash your hand.
Okay.
But obviously, if there's a definite soiling of your hand because of anything, then I would say please wash your hand first. Then please use sanitizer. Let the sanitizer get dried up. And again, when we apply sanitizer, it's very difficult even for the local people to make understand. The steps of hand washing, which is we probably will see that posted everywhere, those steps of hand washing with WHO. That is exactly supposed to be followed up when you're using a sanitizer. It's not about just this and done.
Yeah.
No, it has to be perfectly the way the hand washing has to be done. Exactly in the same way you have to apply your sanitizer,
Okay.
because otherwise you will still be like there will be few things, few areas of your hand which will be left behind. The
Mm.
whole idea is even if you're using sanitizer, steps of hand washing should be followed for the application of your sanitizer.
Okay. Okay.
But
Okay.
don't worry about the baby, because obviously you're not going to put the sanitizer on your breast or anything. It's all about when you're touching the baby or anything, you have to ensure that your hands are clean.
Okay. Okay.
Yeah.
Because
Oh,
the
yeah.
reason why I asked that question is because sometimes when babies are crying, I did that too with my kids. You understand? When they're crying, sometimes I'll put my finger in their mouth. You know, they
uh,
like to talk on it. So I'm thinking with the sanitizer, with the non thing that
no, so
right.
I would say when there's a situation like that, thorough hand wash, and that's more than enough. Don't apply the sanitizer. Thorough hand wash is more than equal. It's good.
Okay.
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 If
Okay.
you're intended to put the hand inside the mouth, I always like for the newborn baby, sometimes we do it, but we wear the gloves after washing our hand. So
Okay.
that is one thing. If you have a glove, that is more safer option. If you don't, just thorough hand wash and then you can do
Okay, okay, cool,
it.
cool,
Okay.
cool, cool. Okay, I know I'm taking your time, but this is just, I'm gonna round up right now, you understand? Because I know
Sure.
you got so much to do. So what I want to do right now is I want you to leave the words of encouragement for people out there, especially men, because men, a lot of men, they suffer from these mental health challenges, you understand? And they don't want to speak up. You understand? Because they don't want men to look at them and be like, "Aren't you a man? Why are you talking like this? You're so weak and everything like that." So because of that, they suppress so much in their mind. You understand? To the extent that they have these societal thoughts, but they like put it in their mind. And at the end of the day, you notice that, oh, this person is going through this person is no longer alive, this person, because they put so much on their mind. I want you to put it out there that if, don't let me be your mouthpiece anyway, but if someone is going through mental health, they should not be afraid. They should just speak up. Okay, let me stop right there. Yeah, I want you to put the word out there for
Yeah.
people to understand the what is it called? The benefit of seeking help. You understand, when they experience things, and let them know that it is normal and we all going to go through mental health. So just put the word out there for people.
Yeah, I would say that you're right, very rightly said that sometimes we have a very high expectation from men and we think that, they are being born as a male, so they should be more stronger than us. But
Yeah.
no, they are also a sensitive human being. At the end of the day, all, any individual, what we need in our life is love, affection, and care. And
Yeah.
this is the basic requirement for every individual. If that is being granted to anyone, I don't think so there will be any problem. First thing is you have to be compassionate, you have to be loving, you have to understand from each other's perspective. And you have to work towards relationships on a daily basis because it's not a matter of breaking and moving on in life. It's all about making it more sustainable so that you can enjoy the best of your relationship and the time with that person. And sometimes like I read a very interesting quote just few days back on the website where it says that out of all the things I miss the most, I miss my mind. And this was written by one of the person who had mental health issues. And I completely like, when I read that line, I just felt like that, there's very deep meaning to that, that the most important thing which I miss in my life is my mind. That
Wow.
means with time, with passage of time, with all sort of life's challenges or whatever it is there, like the most important thing which is affected is our mind. So I would like to say to everyone, please don't ignore your mental health. Nobody can save you but yourself, and you are worth saving.
Mm.
It's war not easily won, but if anything is worth winning, then this is it. So please take care of your mental health. Please take care of your well-being. Remember, health is not about just absence of disease. It's all about a complete physical, mental, and social well-being. And every domain of it has to be addressed in a proper way in order to enjoy the fruits of life in a better way. Have an optimistic attitude in life.
That's
Deal
it.
with life challenges in a very sportingly way. Anytime if you feel you are struggling, please open up, please speak up, please speak up to your friend, family, or get a relevant specialist advice, but never suffer alone. But at the end, I would say this, you're not alone. Everyone is there. It's just a matter of texting or calling people. So please don't feel that you're left out or you're alone. We all are there with you.
Yes, and you're so right. We are not alone. We just need to speak up. And I want to pass this word to people out there. When people talk to you about their mental challenges, don't make fun of them. You understand? You have to.
Absolutely. I think that's the key. We
Yeah.
have to encourage these people. Like, if they are speaking, we have to let them speak. Because if we are
Yes.
stopping them, they will stop coming to us. And we don't
Exactly.
know at what point or what step they will take. And later, if you regret, there's no point because they showed you the subtle hint that there's something not going right. Please don't make a fun. Please consider them as like show empathy towards them. Consider them this is another human being who is suffering and they need help. So please support them.
Exactly, exactly.
Yeah.
Thank you so much for the word. I really, really appreciate you. And I thank you so much for coming here. Even
Thank
though
you.
the mental health is not part of your line, is not for your profession, but the way you just like, analyze the whole thing, the way you just, everything you said is just like,
Bukky, as I said, I'm the outcome of my past. Nothing is easy for me. Even if people see me that where I have reached today, although I've not achieved many things in my life, I'm still like trying to get a lot of things. But it's all an outcome of the positive attitude which I had, and I'm very, very thankful to my parents because I think if I get my positivity from somewhere, it's my mother and it's my father, and they have never let me to sink despite having all the life challenges in life. And if I feel mentally lost, the only person I look forward is my mother and father still. Like, I don't want to sound weird that at my middle 30s, I'm still like mom and dad, daughter. But
love,
I'm just saying that if I know the God is there physically somewhere, I know that that God is there in my parents. And I consider them that if I need anything, I know that there are these people who will be always non-judgmental and they'll always accept me irrespective of how many flaws I have in my life.
yeah,
So it's something to believe that God is always there around you in one way or the other form. Never lose hope. He's always has got a big plan for you. Even if there's anything like any disappointment in your life, never consider there's any word called failure in your life. It always either give you a learning or an experience, or it just gives you wisdom. So please don't get disappointed with this thing.
Wow, wow. I just love, I love your view about life. Really, I love it. It's, you see, when you believe like that, you understand. First of all, you have your parent there. First, second of all, you believe in God. What more do you need? You understand? It's like you
Absolutely.
got everything. You understand? That is
Like Bukky, my mother had so many health conditions. Like in my childhood, for almost in a year, 6 months, I've seen my mom on bed,
wow,
and with all the things. And me and my brother, we used to eat every day outside from hotel. My dad used to bring, and it was a very challenging situation. When I was very small, then my mom was immediately transported to the cardiac unit, where they said that she has to undergo heart, operations and other things. And I was so scared, and I have seen those suffering. Although we were very fortunate that that was aborted at that time, the surgery was not happened because some other doctor challenged that person, that doctor, that no, I don't think so. This is right. Let's control the way. But in my childhood, I've seen my mom suffering so much. But when my dad had cancer, my mom's attitude completely got changed. She was like a person who was always sick for the rest of the life. But when my dad got cancer, she was completely a different and a strong woman in life, standing very firm on her feet, just to support her husband, just to support her family, and never let any individual to break or fall off out of it.
wow,
And that turnover of my mom's personality was so much encouragement, like encouragement for me, was that I can't even imagine anybody so strong than my mom. Having every, like, if you say any organ, there's not even a single organ which is not being affected in my like in my mom's body. But if you see her, if you speak to her today as well, she just smiles. She
wow,
just smiles. She just laughs. And me and my mother, when we meet each other, we, even for a very stupid thing, we laugh for almost half an hour, and then she's my laughter therapy, and that's why every day I have to give her a call. Every day when I'm stuck in my life and I don't know what to do, I just give her a call. And even if I'm saying, Mom, I'm not prepared for the interview, I don't think so. Oh, Neha, please come on, just go there, and after half an hour you'll receive a call and you'll be shortlisted.
wow.
And I was like, Mom, you always say that, but I don't know. She said, Neha, please do. I know you much better than me. And you'll not believe, I went for my consultant interview. This was my first consultant post, and I got it. And I was like, Mom, I got it. And she said, I know. What's new in that? And I was like, even happy. So, you need these people around you. I'm not saying that I found my God, or I found my best buddy in my mom's body, like in my mom. So
Yeah,
I don't need anybody else. I'm more confined. I'm like, I know that this is the person I need to speak. And I always pray to God that give her a very long life, because I'm greedy here. I want her to be with me. But at the same time, I always wish that we need somebody in our life to give that positivity. And if you know who is the person, you are the most blessed person in the world. And these humanly made problems and challenges, it is something fixable. These all can be fixable. So embrace the life and value the people around you.
wow, wow. Thank you so much. You know what? Ever since I started this show, you understand? Everyone that I bring on the show, you understand? They come thinking that they're talking to me, you understand? But I learned so much from them, you understand? The way what they passed out is just open so many, it opens my eyes to so many things, you
Yeah.
understand? So
Yeah.
from what you said, from our discussion right now, I've been able to see so many things, you understand, about my views on life is has completely changed, you understand, and I see where you got your strongness from. You understand? Because I can see it's from your mom. You understand? I can see how you say your daddy went through cancer and everything like that, and your mom. You understand? She was there, very strong, and she
She
stood by
changed her
you.
body, and the only way how she actually dealt with her physical challenges, like whatever health condition she had, was her mental. She
Yeah,
just made it so strong that her body stopped, giving her troubles anymore. She
wow,
was not having the similar things which she was having before, because previously she was like, maybe I don't know whether she was secure, my husband is there, my kids are there, and later she realized, now my husband is like, he has got a cancer now, and if I am not going to be there, then how that will happen? And her mental health became so different at that point of time that she just took complete control of her body, saying that no matter what, I'm going to deal with this shit, and I'm going to deal it, and I'm going to take out my family in a best possible way out of this. My dad got, he got surgery, he got all the radiotherapy or whatever, anti-androgens and whatever. He got completely cancer free. he recovered. But my dad was like, his mental being was quite affected after that because he was a police officer. He was a very strong police officer. But after that, after this thing, it's definitely impacted his well-being. But I can see that you can heal problems in your body by your mental, if you make your mental health very strong, no matter how much pain you are through, whether you have got arthritis, fibromyalgia, PCOD, everything is controlled by your brain. And I want to make everybody to understand that if you make this thing strong by either meditation or by anything else, that's the best thing you can do to heal anything in your life. And that is
Yes.
the same vibes which we will transfer to every person who is coming across your life.
Mm.
So please take care of your mental health. Don't ignore it. This is the first priority. Second, I would not say second or third, but yes, physical and social is like second and third for me. First thing is mental health. Very, very important.
Wow, wow. Thank you so much. You know, in counseling, there's a word that says that we all, human beings, we all have the innate ability to heal any diseases, anything in
Absolutely.
our body. You know,
Absolutely. If you see,
yes,
like in the ancient time, people used to do Reiki or something. Have you heard about Reiki? Like there's a one way of, like, basically people with their meditation, they empower, they get some sort of like, strong vibes by which with
yes,
their hands they can keep on the areas where the people or person is having pain and they can heal it. It's all about because they have made themselves so strong and they can give the similar vibes to others and they can heal the other people as well. It's
yeah,
all about mental boosting. It's all about mental boosting. Nobody is born like to become a monk or to become a great leader or to become a saint or something. It's all about the wisdom they have gathered, the experiences, the challenges they have faced in their life, which has molded and shaped them the person what they are today. It's
yes,
all the outcome of that. And remain assured that nobody is having a smooth life. Everybody has got their own ups and downs in life.
yeah.
It's all about how you deal with it and how confident you are and what kind of support you have. So please take care of yourself. Never suffer alone. Speak out, help yourself, and heal everyone within yourself as well as heal every individual who's coming across in your life.
Yeah, yeah, you're so right. You're so on point. You know, I just want to thank you so much. You know,
Thank you, Bukky. I really appreciate for having me
I
here.
appreciate you too, cause I just feel like we should go home, but I'm like, no, this lady got to go. She got work to do. You got to go. Cause I just when I see when I'm having this section, I'm a different person. You understand? I just want to
Absolutely.
ask my guests so many questions. You understand? So, but you know what? Let me spare you the time. Let me say
Thank
that.
you.
Let me just let you go. You understand? Because there's so
Thank you,
many
Bukky.
questions, but I'll just have to let you go because I know you're a busy lady and everything like that. So I want to say thank you so much. Thank you so
Thank you.
much for your expertise. Thank you so much for putting the word out there and also using your own personal experience. You know that is something. You understand? It's not just about what you read. It's not just about what you heard about other people, but this is about you. You understand? So I
Yes.
appreciate you so much for doing
No,
that.
but Bukky, lastly, I would like to say that you're doing an outstanding job, first of all. The
Thank you.
way you are actually bringing the people on the stage, letting them to express themselves, to share their life experiences, to help so many people in the community, that's outstanding.
Thank you.
And even like when you actually was asking the questions, I can see that, there's a thirst as well to know a few things. At the same time, I can see that these are some of the experiences which you have also put there. And these are the common things. So that means even what you were asking me is the same thing which I am facing in my life as well. So
Wow.
we all individual, irrespective of where we were born, where we are staying, we all have the same problems in life. And it's
Exactly.
all about making a soft balance between both of them. So I really appreciate what you're doing today by helping so many people who are watching this show. And I hope that you should take care of yourself very well, your health, all the three domains of your health, and you keep rising, keep shining like the way you are doing right now. So I really appreciate
Thank you so much. I appreciate that word. I really, really do. Really, you touched my heart so much. Thank you so much. And like I said, I have learned so much, and everything that I've learned from you, I'm holding on to it. You understand?
that. Thank
I'm
you.
really holding on to it. Thank you so
Thank
much.
you.
And I
Thank you,
wish
Bushi.
you good things in all your endeavors as well. And keep being you. You understand? You are
Absolutely.
good. Your profession and everything, you're so good. And you're
Thank
so
you.
pretty as well.
Thank
So
you. Thank you,
beautiful.
Bushi.
Yeah, thank you so much. So
Thank you.
I'm gonna have to let you go. But before I go, let me just put this word out there for people. You understand? My word today is I want people out there to focus on today. You understand? Because the thing is, we cannot change what happened in the past, and you cannot control how people treat you. So don't be afraid to seek help. Just like our doctor just said, when you need help, speak up. You understand, and just go for treatment, go for whatever you can go for. You understand, and just don't compare yourself to any other person. Be yourself. Like I said, yesterday is gone. We cannot take you back. We can bring you back. So let's focus on today and be the best that we can be. So, like I said the earlier, Dr. Neha, I thank you so much. Thank
Thank
you
you.
so much for coming
Thank you,
on the
Bukky.
show. I really
Thank you.
appreciate you. Thank you
Thank
so
you. Have
much.
a lovely day. Thank you.
You too now. Take
Bye.
care.
Bye.
Okay, bye.